Anyone can take the first question for Fakra. Can you? Okay, okay. No, will you take? Okay. Yeah, just post it in the group.
Ma'am, who's taking?
Yeah, you can take it. Yeah, I'm waiting for you.
Okay. Ma'am, these January 2019 recalls?
Yeah.
Ma'am, we left yesterday from...
Yeah, because these are with the options. Like at the end, we can do one with the without the options. They are without the options, so we can finish
Okay,
the ones with the proper with the options ones.
so I should start with this, right?
Yeah,
January.
yeah.
Okay.
And then,
Percentage of Brenner tumor of ovary which are malignant, 2 to 5%. Then diagram of pelvis. They were asking arcuate line. Okay. Then diagram of rectus muscle below the umbilicus, asking for during suprapubic insertion after cutting rectus sheath you will encounter. Answer, fascia transversalis. Okay. And diagram of levels of epidural anesthesia. This diagram is, it's not clear.
yeah, it's not clear. Yeah, exactly. It's not clear.
Then complication of retroverted uterus, incarceration, and picture of Trichomonas vaginalis. Okay. Semen analysis.
Always like if you see with this diagram, you can see over here on the top on the trichomonas there are flagellas. So if the diagram is given to you, anytime you'll identify it with the flagella of that trichomonas.
Yes, ma'am. Semen analysis report normal. Okay. Then woman with 28-day cycle went to perform hysterosalpingography. 6 to 10 days.
Nupur, which paper is this?
2019 January.
And shared in PDF?
In the group.
Ma'am, shared in PDF or?
No.
Group.
Yeah.
Okay.
Question number 9. Decrease in amplitude of ultrasound due to absorption scattering reflection is called as?
Tell us what it is called. Reflection, refraction, or attenuation.
It's called as attenuation, ma'am.
Yes, it is called as attenuation. Yes.
Okay. A scenario on botulinum toxin is now used to treat neurogenic bladder because of its ability to inhibit the release of acetylcholine A. Ma'am, A.
Neurogenic bladder. No, botulinum toxin, what it does? It inhibits the release of acetylcholine.
Yes, ma'am. Yesterday we did this question, no? Something like this.
That was not. That was for tetanus toxoid. Or it was for botulinum.
I think, ma'am, it was for botulinum. I'll search again.
Okay, let me
The shared screenshot.
Okay, yeah. Let's check it because in my mind also it was. I think it was. I thought it was a different one.
Yes, ma'am, it is botulinum toxin. I'll share the screenshot again.
Okay, so. Yes, yeah. It inhibits the release of, yes, if it, yeah, it's the same one, yes.
Material of site on the perineal nerve terminus.
Ma'am, shall I continue?
Yes,
48.
yes. Yeah.
Okay. Schiller dual bodies is found in choriocarcinoma, endodermal sinus tumor, dysgerminoma, teratoma, gonadoblastoma. Ma'am, dysgerminoma?
Any other? In this germinoma, what is raised? A tumor
LDH.
mark. Yes, in LDH is this. And yes, in dermal sinus tumor, what happens?
Alpha fetoprotein is raised.
Endodermal sinus tumor?
Yes, ma'am.
Yes, and yes, very good. And one more thing is also there.
This Schiller dual bodies?
Yes, yeah, Schiller dual bodies, they are found in the endodermal sinus tumor.
Okay, ma'am. Okay. Beta HCG tumor marker for choriocarcinoma.
Very good.
Rubella type of vaccine live attenuated.
Yes.
Postmenopausal bleeding with granulosa cell tumor of ovary effect on endometrium. Proliferative.
Proliferative. Yes, very good.
Group A streptococci on Lansfield shows, I think, ma'am, it's beta hemolytic. A.
Yes, it's beta hemolytic. Yes, very good. And you missed one question, I think, in the okay, rubella. Okay, yeah. Okay, I'll post that question. I missed that question. Okay.
Ma'am, in between rest all are repeats.
Yeah, in between they all are repeated. Yes.
Okay.
Nurpur, I have missed first 5-6 questions answer.
Okay, I'll tell
Okay.
again. No,
Yeah.
they written answers only. We did not answer anything.
Okay.
3% of Brenner's tumor of ovary which are malignant are 2 to 5%. Then a diagram of pelvis was given and we had to identify arcuate line. Then diagram of rectus muscle below umbilicus was given asking in suprapubic incision, when you cut rectus sheath you will encounter. Then fascia transversalis is the answer.
Okay.
So every answer is given. So
Um,
62
but answer a semen analysis report. Okay, it
was
was
normal.
normal.
The question is not given. Yeah. Okay.
And decrease
62.
okay. 62.
Decrease in amplitude is it's called attenuation. Question number 9.
Okay, attenuation.
Then 62.
Hmm.
Innate and adaptive system are linked together via leukotriene, cytokine C, tumor necrosis factor. Innate and adaptive immune system. Cytokine C, ma'am.
Yes, very good. They're linked together with cytokine. Yes.
TRH is a peptide, ma'am. We did.
Yes, CRE, it's a peptide. Yes.
Tripeptide or glycoprotein, ma'am? It's tripeptide.
Mm-hmm. Yeah, it's tripeptide. Yeah, it's tripeptide because TR na, yeah, TR for tri, yeah.
Okay, ma'am. Then, yeah, okay. Delta cells of pancreas secrete somatostatin, glucagon, insulin. Ma'am, somatostatin.
Yes, very good. They secrete somatostatin.
Okay. Then Wernicke-Korsakoff, I think it's that.
Yeah, Wernicke-Korsakoff, yeah.
B,
It is caused
vitamin
by,
B1.
yeah,
B1.
B1. Yes, very good.
Estrogen type of pregnancy secreted by placenta. Estriol.
Yes, very good.
A 20-year-old lady menarche since age of 12, complaining of heavy menstrual bleeding since menarche. CBC done, physical examination, nothing remarkable. What to do next?
Yeah.
20-year-old menarche since age of 12, heavy menstrual bleeding. Done, physical examination not remarkable. Do nothing, thyroid profile, serum ferritin, clotting factor, FHS. Ma'am, clotting?
Yes, why clotting? Yeah.
Ma'am, because CBC is normal and she's bleeding, so it could be bleeding diastasis.
But it cannot be thyroid problem.
It can be, but ma'am, she has no other associated complaints.
Yeah. For thyroid, we always check for the like if the history or if the question is talking about the symptoms of thyroid, then you will only do for thyroid test. Otherwise, never you will go for thyroid testing until unless the patient tells you about the symptoms. So that is why here the option is clotting profile. Yes, very good.
Okay, ma'am. Then there was a question on perinatal mortality case, and the answer was 100 by 1000 something. Borner cells found in duodenum. Electrophoresis. Hemagglutopathies. So it was beta thalassemia major, normal. I cannot understand, ma'am, this question.
No, they are saying that this is the diagram given in front of you, and you have to tell them that what it is.
Okay, and it was alpha thalassemia major.
Yes.
The answer.
Yeah, the answer
How?
is alpha.
Because HbA is present, HbF is absent, HbA2 is reduced or absent, and in beta thalassemia major also HbA increases, so it matches with that.
Yes, that is the reason. So in the exam, you will have to
Yes,
identify
got
it. Okay, let me give you that. Now this question, it is in the form of diagram. Previously, in again this question. Okay, I'm not going to tell you if I tell you. Okay, now read this one and tell us what will be the answer.
A 21-year-old pregnant woman is found to have Hb of 10.2 gram per deciliter on routine blood test with MCV 80. Serum electrophoresis reveals HbF 5%, HbA1 of 80%, HbA2 of 15%, and HbS of 0%. Her ferritin levels are normal. Most likely diagnosis is sickle trait, sickle cell disease, beta thalassemia minor, alpha thalassemia, beta thalassemia major. Ma'am, beta thalassemia HB is normal.
Ma'am, HbA2 is raised. So it is a beta.
No, yeah, beta. But which type? Beta minor or major?
Minor, ma'am.
Why not major?
Ma'am, HB is normal. It's not like 6 or something.
A1.
10.2.
No, sometimes there's a chance that it can be normal also in the major also.
MCV is normal, electrophoresis.
A1 is increased. I think in beta both will be reduced significantly.
Yes, very good. Yeah, one more thing is also there.
Ma'am, HbA1 adult hemoglobin is.
Ferritin is normal in beta major. Ferritin will be high.
No, we don't talk about ferritin usually because ferritin is
no
not
change in ferritin.
Yeah.
Then don't know, ma'am.
Yeah. Okay. Yes,
Ferritin will be affected on
ferritin. Yes, because
iron
also in
deficiency.
this we don't. Yeah, iron deficiency. So can you tell us what will happen?
Ma'am, it's the beta thalassemia, but
Minor or major?
Because HbA1 is normally 97%. So it's 80% and it's low, and HbA2 is 15. More than it should, if more than 3.5%, then mine.
Yes.
Minor, beta thalassemia minor.
Yes, it is beta thalassemia minor. The main reason is, yes, you all were correct with your explanation. But if you look at hemoglobin F is given as 5% in the question. If it is thalassemia major, what will happen? The hemoglobin F will be more 90 or more than 90 plus.
Yes.
Okay.
This is the, and now just read this also for us so that we can all remember it. I'm posting it now. I'm posting this. Yeah, read this so that you can identify now all of them.
Normal.
In normal, HbA is the maximum, and HbA2 is less, and fetal hemoglobin is also less. In beta thalassemia trait, HbA2 is increased and HbA is decreased to some extent. In beta thalassemia major, fetal hemoglobin F is the major chunk. HbA is decreased and A2 is increased. In sickle cell trait, HbS is present, HbA is also there. And in sickle cell anemia, HbS is widely increased and HbF is present. I mean, normal patient HbA1 is more than HbA2. I thought HbA2 was more.
No, one is more than 2 in normal.
Okay. Okay.
So now, if they call yes in sickle cell, yes.
In sickle cell, no HbA.
No, there will be S major, no, because now it is hemoglobin S, that is sickle cell. Only very little will be hemoglobin A.
Okay. But
The
in
ones
disease,
that are blue mark, yeah, the one that are blue mark, they will be in major amount. You know, the blue lines that are shown, yeah.
So in sickle cell disease, HbA is nil, 0.
Yeah, almost it is nil. Yes.
Alpha
So now if
thalassemia is not given in this chart, ma'am.
yeah, alpha thalassemia they don't, because beta thalassemia is the most common one. Alpha thalassemia.
But he said this question and electrophoresis, they had asked alpha thalassemia, he's saying. 93.
93.
It was alpha thalassemia major.
93, yes. Which you previously did.
Okay. This one is alpha thalassemia major. Okay, let me see if the same type of question is there. Okay, let me check.
No, what is the answer of 62? Innate and adaptive system are linked together by
Cytokine C.
cytokine. Okay. B. And delta cell, delta cell of pancreas secrete somatostatin. And thyroid releasing hormone is glycoprotein.
No, tripeptide.
Tripeptide, TRH. And Yes, yes.
Okay.
And Nupu 65 wrinkle Karakov syndrome.
No, that's Wernicke Karakoff, and it's B1,
It's
vitamin B1.
vitamin B1.
Okay, I'll check this in the guideline and then we'll tell you.
Okay,
Okay, ma'am.
ma'am.
I'll check this in the guideline because there's a complete guideline on thalassemia and hemophilias and everything. So I'll check that and then we'll.
Ma'am, but in new guideline you have shared trimester wise hemoglobin. But but during exam I checked
Yeah,
the
actually, what happened yesterday, I was reading that guideline at night time. So
ice guideline.
it
This is the latest because
yes,
I
it's
have
not a yes, yes, it's a green top guideline, blood transfusion in OBS.
of which year?
I think it is 2017 or 18. And
Okay.
then in the NICE also, NICE antenatal care. Again, it is written the same thing over there also. So that is why as soon as I read this, I immediately posted in the group. I thought, yeah, we did it that way.
Okay,
Ma'am,
but
how
ma'am,
much time does it take to read one guideline?
Like now I open my guideline now. So what happens now? I have marked everything, so it's easy for me to read. Just
okay,
first time it takes time because some of the guidelines they're very long and very small guidelines they take 1 hour 2 hours just to complete because they're really small.
And how many such guidelines are there for part 2?
there
I
are
mean
so
there's
many.
yeah so many. There's 60 70 plus guidelines are there.
Okay, okay.
60, 70 topics, ma'am, are different guidelines.
Yeah, no different guidelines and again then you have to read that also what we call uh, yeah, you have to read the SIPs also we have to cover the TOG articles we have to cover. So it's quite much, but it happens.
And ma'am, part 3 is very difficult.
Part three it's easy, but but part three it's people say that part three is easy as compared to part two. The difficult among part one, part two, and part three, it's a difficult exam. It's a second part two exam is the difficult exam in the whole world. Second most difficult exam in the whole world after anesthesia exam. This is the most
Oh,
difficult one.
okay.
Yeah.
Okay. Vitamin D in pregnancy. I think they are asking the
Yeah.
recommended daily dose, no, ma'am?
Yeah. Tell us the daily dose. Yes.
400 international unit.
No, 400 international unit is for what?
Folic acid.
Yes,
That is
that is
very
for folic
different.
acid. Yes, tell us.
Don't know, ma'am.
Vitamin D also.
Yes,
And
vitamin D, normal levels. It is 10 microgram per day.
10
10
microgram.
microgram per day. Okay, ma'am.
And what happens to level of vitamin D in pregnancy? Is it increase, decrease, or unchanged in pregnancy? What happens?
Um, Normally unchanged,
Yes, it is unchanged in pregnancy.
but if low, then and this dose is prophylactic dose, 10
No,
microgram or
yeah. This dose we have to give to every patient. Yes, it's a prophylactic dose. But normally, if we talk in general, the in pregnancy it is not affected.
Okay. Cardiac output increases in first stage of labor. 20, 30, 10, 50. First stage. 30%, ma'am.
30%. Any other?
first
Ma'am, 50% is in the
Yes, it
second stage.
50,
20.
50.
50.
Yeah,
Okay.
50 during the first labor. Then and maximum it is in the third trimester, third stage of labor or after the delivery, whatever option is given to you. Sometimes these are both options are given together, or if they are given separately, then you will mark as after delivery.
Okay, ma'am. Ma'am, maximum is after delivery, and I think maximum is 50%, isn't it?
No, maximum is more than 50%. 75 to 80% is the.
Okay, okay, ma'am.
Yeah.
Fetal cardiac output to fetal kidney. Ma'am, okay, A 10 to 15%, 20 to 25%, 35% less than 5%. Ma'am, what does this question mean?
They're asking that fetal, that like fetal is also having its heart and it's also pumping the blood. So what amount of blood does it goes to the fetal kidneys?
25,
Okay,
35.
okay. What amount of cardiac output is received by the fetal kidney? Okay. 20 to 25%? 35%?
35%? Less than only 5% fetal cardiac output in the fetal life. But in the adult life, what happens? How much is the cardiac output received?
25%.
25%. Yes, very good.
Okay. Antenatal anti-D at 28 to 34 weeks. 500
Yes.
international.
Yeah, 500, and we check it at 28 to, we give it at 28 to 34 weeks after checking it.
Okay. Remnant of patent umbilical artery is superior vesical artery.
Yes, very good.
A scenario of 15-year girl wants contraception.
Yeah.
Fraser.
So what Fraser law, we follow it.
Okay. Gartner cyst is derivative of mesonephric duct. FGM figure. And what's
Let me say,
FGM?
yeah, FGM.
Fetal growth
Okay.
monitoring?
No.
FGM.
Genital mutation.
Yeah,
Female
genital
genital.
mutation. What happens? Female genital mutation, especially in UK and other countries, also happens in lower in underdeveloped countries. What happens at the genital area of the woman, like the vulva, the vagina, they are cut. That
In
is called
Africa.
as female genital mutilation.
Ma'am, as in they are cut by some custom practice or
by
by
custom
crime?
practice.
By
By
custom.
custom practice.
Okay.
The reason why they do it, because they think that by doing this cutting, what will happen, the sensation, the sexual arousal is reduced as a result of that. So that if the sexual arousal is reduced, so the girl is unlikely to have involved in these sexual activities when she grows up. And it is usually done after the age of 5 up to 15 years. It is done.
Ma'am, it's done in UK. It's practiced in UK.
No,
The guideline, yes, there's a whole guideline on this. So definitely it is done in UK. The UK people, they have made a guideline on top of it.
mostly it is practiced in Africa.
Yeah,
Ma'am, I'll
usually.
read this one which Sadaf has shared, and then I'll read yours again.
Yeah, okay.
Okay. Female genital mutilation type 1, prepuce removal only or prepuce removal and partial or total removal of clitoris. Type 2, removal of clitoris plus part of or all of labia minora. Type 3, removal of a part of or all of labia minora with labia majora, then sewn together. Removal part of all of labia minora with labia majora sewn together, covering the urethra and vagina and leaving small hole for urine and menstrual flow. Oh my God. Okay. So A, normal anterior clitoris, urethral opening, vagina, labia minora, labia majora, posterior. Type 1, prepuce removal only. B. Prepuce removal and partial or total removal of clitoris. That is type 1. Type 1A and type 1B. Okay. Type 2, removal of clitoris plus part or all of labia minora. Type 3, removal of part of or all of labia minora with the majora sewn together, covering the urethra and vagina and leaving a small hole for urine and menstrual flow. What are the different types? This is this. Okay, I'll read again.
Yeah, this is this one you just whenever you go through, just go through this one and the above diagram. They are from the guidelines. I've just taken it. So because in the exam for you, it will always come from the guideline, because this is the guideline which is made by the RCOG people. So
So,
try
ma'am,
to
like, which one to read? The both diagrams that
yeah,
you have
this is in
shared?
the form, yeah, in the form of, this is in the form of the diagram. If the diagram is given to you, you can identify what type it is, because in the exam you will be given the diagram and you have to identify the type of female genital mutilation. Or if they have given you the explanation, so the explanation is this, because these both are the below one, the last one that I've sent. These are the explanations that what is the type which they ask.
And type 4 are all other harmful procedures to female genital area for non-medical reason, including stretching, pricking, piercing, cutting, scraping, and burning.
Yes, that piercing usually that is done. It's a part of female genital mutilation. It's not normal. It's not good. It's again a mutilation.
Okay, ma'am. Then comparison of alpha thalassemias. Genotype HbA normal 97 to 98%, HB bar 0 and HbH 0. And silent is 96 to 98%, HB bar 0 to 2%. In alpha thalassemia trait, HbA is 85 to 95%, and HB bar is 5 to 10%. And in hemoglobin H disease, HbA is decreased, HB bar is 25 to 40%, and HbH is 2 to 40%. And hydrops fetalis 80% with 20% HB Portland and 0 to 20% HBH. Okay. Okay. 111. When to supplied on?
And what point in the fetal head ventouse is applied?
Imagine vortex.
Yes, so yeah, vertex. It is applied. Definitely, it is applied on the vertex. But like on what point? Like which suture it is applied? Coronal suture, sagittal suture, anterior fontanel, posterior fontanel. Where it is applied?
Ma'am, sagittal suture, 3 centimeter
Yes, very good.
anterior to the posterior fontanelle and 6 centimeter posterior to the anterior fontanelle.
Yes. Yes. Now, yeah. What happens here? Like in the ventouse, whenever we apply the ventouse, what happens? It is applied at the sagittal suture of the fetal scalp. Then,
Flexion
what
point.
happens? Yeah,
It is
it
called
is.
flexion point.
Yes, it is called as flexion point. Now, what is this flexion point? We have two fontanelles in the brain. The one is the anterior fontanelle, and the back one, or the on the back side, is the posterior fontanelle. So what happens? From the anterior fontanelle approximately 3 centimeter, and from the posterior fontanelle approximately 6 centimeter. We leave this space. So whatever that space which is left in between, we apply there the cup. That is called as the flexion point. And in terms of suture, if they ask you, then you are going to tell them it is going to be the sagittal suture where the ventouse is applied, or the vacuum cup is applied. Sometimes vacuum cup, it is also known as kiwi cup. So don't get confused if they say you kiwi cup. It's the same thing. That they are talking about the vacuum only.
Okay, ma'am. Postpartum depression is caused by, ma'am?
Yeah,
Methyl
it's
dopamine.
called, yes, with dopa. Yes, very good.
Puke maximum score. I think, ma'am, it's more than 15. So 15 or 30?
Yes,
15.
it is 15. Yes, maximum is 15 score, and minimum is the 0 or 1 score.
One.
And yeah, 3 centimeter from posterior and 6 centimeter from anterior fontanelle. Yes,
Okay, 3 centimeter from posterior and 6 centimeter from
from
anterior.
anterior. Yeah, T3.
Ratio of T4 to T3 in blood.
Hmm. How
T4
much
is
T4 is or T3 level is in
0.1
the?
and T3 is 1%. So, ma'am, 1 is to 10.
Sorry, what did you say? T3 is 1. And what about T4? How much it is T4?
Yeah, 0.1.
2, 1.
0.1.
No, what it is 14:1. T4 is more in the blood. 4.1, it is the free amount. That is free T3 or free T4 that we studied before.
Okay. Okay.
It is now asking you in the form of ratio. And ratio always will have 2 dots in between.
Okay. 14 is to 1.
Yes, 14:1. Yes.
Okay, ma'am. Yeah, 13 is to 1. And the three methods give a final dose T4 is to T3 ratio between 13 is to 1 and 20 is to 1. Okay. So 14 is to 1. After pelvic surgery of sacrospinous fixation for vaginal wall prolapse, patient complains of perineal and vulval pain exaggerated on sitting. Which nerve is most likely damaged? Pudendal nerve, ma'am.
Yes, very good. It is the pudendal nerve that is damaged.
Fetal kidneys mature to form urine at 10 weeks, ma'am.
Yes, 10 weeks. Yes.
Placenta previa early confirmed at what gestational age? Ma'am, somebody had asked this question and the answer was 32 weeks.
Yes, very good. First, what happens when we do the anomaly scan at 20 weeks? So, what happens? We find the in dating scan, we cannot find the placenta. That is done at 10 weeks, 10 to 13 plus 6 weeks that we do. So, we do an anomaly scan at 20 weeks where we find the placenta. If the placenta is low lying, then what we do? We repeat the ultrasound again at 32 weeks to confirm whether really it is placenta previa, because after what happens 20 and in between 32 weeks there's a lot of time in between. Sometimes the placenta, it moves upward, it goes upward from low lying position to its normal position. That is why we give this much time to the placenta, so that if it want to go up, it can go up. If not, then it is confirmed by 32 weeks of gestation. And again, one more thing, if at 32 weeks still the placenta comes out to be low lying or previa, then again we repeat it at 36 weeks before deciding the mode of delivery.
Okay, so here placenta previa early is written there for 32 weeks. Placenta previa
No,
late is
because yeah,
36 weeks.
no, late, or if the option is also not given here. Maybe in the exam, if you are given any option like 32 is not mentioned, only 36 is mentioned for you. So you will go for 36 then.
Okay, ma'am.
If ma'am both given 32, 36, then
You will have to choose like what they are asking in the questions. If they want the confirmed diagnosis, then, or they want to decide the mode of delivery, then mode of delivery will be decided from 36-week scan.
okay. Because at 32 week lower uterine segment is developed.
Yeah, it is.
So
Yeah, it's just about, yes, it is just developing. That is why.
then this is
Then,
2019 paper.
Yes.
ma'am, it is so difficult. So many questions not repeated.
No, every paper you will find that it's not, because we have done so many. That's why you're feeling. Otherwise, every paper, trust me, in every paper you will find more than 150 questions. More than 150 questions. That is
Which
too
are
much.
repeated.
Yeah. You only
But
have to
ma'am, this paper has so many out of like course questions.
there must be, something must be there. Definitely there must be. The questions are not also written properly. Like they're not giving the any like options are not also given in this paper. So nothing is being able to understand. This paper was very difficult. I was trying to like make it out.
Yes,
What should we
ma'am.
make without the options?
Yes, ma'am. To 129.
Hmm.
CRISPR, CRISPR or Cas9 indicate what in molecular biology? A transcription factor and an enzyme, or DNA and an enzyme? Ma'am, I think it's a transcription factor and an enzyme.
Yes, it's a transcription factor and a DNA. Yes. Now tell us this one.
130, identify the muscle, and it was obturator internus.
Hmm.
Monochorionic and diamniotic occur at what stage?
Yes. At what stage? Gastrula, morula, what stage it occurs?
Ma'am, like it is, we read when if the embryo divides between 0 to 3 days, then it
Hmm.
is diamniotic dichorionic. If
Yes,
it
very good.
divides between 4 to 8 days, then
Four
it
to
is
7 days. 4 to 7
4 to
days.
7 days. Then it is monochorionic diamniotic.
Hmm.
If between 8 to 12 days, then it is monoamniotic monochorionic, and more than 12 days it is Siamese twin. So
Yes.
fourth day, ma'am.
Yes, fourth
Answer
day. Yes, fourth day. Or if they ask you in what stage, so it is done at the morula stage.
modular stage. Okay, ma'am.
Morula stage.
Okay, ma'am. Testicular appendix is a derivative testicule of, I think, yeah, testis of appendix.
Is the
Testicular
derivative of
appendix.
which? Mesonephric or paramesonephric?
Ma'am, it
Testicular
was
appendix.
testicular appendix was a derivative of pa- paramesonephric.
Paramesonephric? Not mesonephric. Yeah, it's paramesonephric. Yes, it's paramesonephric.
Then a scenario about patient developed caput medusae. It is a remnant of umbilical vein.
Yes, caput medusa, it's a remnant of umbilical vein.
Ovaries contain enzyme for androgen production. 5-alpha reductase.
Alpha, yes.
Ma'am, aromatase is for conversion of androgen to estrogen, right?
Androgen to estrogen, yes.
And 5-alpha reductase is for production of androgen.
Androgens.
Okay, ma'am. In phenylketonuria, there is
Recent
deficiency.
what did you say? No. Nuku, what did no? What did you say? Say repeat it again.
Ma'am, ovaries contain enzyme for androgen production.
Hmm. Hmm. Yes.
5-alpha reductase, 11 beta hydroxylase, 3 beta hydroxysteroid dehydrogenase.
Hmm.
Isoform 5-alpha reductase.
No, 5-alpha reductase will convert what?
I think testosterone to dihydrotestosterone.
Yes. So
So it will be 3 beta hydroxysteroid dehydrogenase.
yes, yeah, it will be 3 beta hydroxysteroid dehydrogenase.
Okay, yes, ma'am. Okay. In phenylketonuria, there is deficiency of enzyme known as hydroxylase. This enzyme catalyzes the reaction and converting phenylalanine to tyrosine or tryptophan.
Tell us.
Phenylalanine to tyrosine, ma'am.
Yes, very good. It is phenylalanine to tyrosine.
One spontaneous mutation in humans occurs over years. 1 in 1 million, 1 in 1 crore, 1 in 10 million. One in 1 million.
1 in 10 million.
1 in 10 million.
Yeah,
Okay.
mutation is very less.
Ma'am, but we see so many genetic disorders which are because of spontaneous mutation.
But then they are not alive. Then they regress by itself. The nature then destroys it. It does not allow it
Okay.
to remain.
Okay. Warfarin causes embryopathy at what gestational age?
Hmm. Yes, tell us. We discussed that also before. Do you remember? Or I should give you the options.
In first trimester, normally.
Yes, first trimester. Yeah. So if we ask in terms of a specific gestation age, then what it will be?
Warfarin causes
10?
Ma'am, 6 8.
Okay, let me give you the options: 2 to 4 weeks, 4 to 6 weeks, 6 to 9 weeks, or 9 to 11 weeks.
6 to 9?
Yes, very good. It is 6 to 9 weeks in which embryopathy occurs. Before that, we can give warfarin, but there's a risk of having chances that baby will be affected, but less chances there. Peak chances only in between 6 to 9 weeks, and after 9 weeks, again we can start with the warfarin if any patient does not have any other option to take the drug.
Okay, ma'am. Ebola virus is
And an example of which single stranded, double stranded, DNA and RNA virus. Tell us.
single-stranded RNA virus.
Yes, very good. It's an example of a single stranded RNA virus.
Okay. Varicella is DNA virus, ma'am.
Varicella is a DNA virus and it belongs to which family?
Herpes.
Herpes
Yes,
family, yeah.
yeah, it belongs to herpes family. Yes, very good.
Herpes simplex virus 1 is DNA virus.
Yes, double stranded DNA virus. Yes.
Vitamin K source.
Is it what? Is it green vegetables? Is it fruits? Is it beans, leans, meat? What it is?
I think one is no, that was A. Vitamin K, cod liver oil.
Yeah, cod
Sorry,
liver oil is for A.
A. Okay. A. I don't. Liver, ma'am. Liver. Vitamin K liver. I don't know,
Yeah,
ma'am.
no, yeah. No, vitamin K sources from the leafy green vegetables.
Okay. Leafy green.
Vegetables.
Okay. Pelvic diaphragm is formed by levator anion, coccygeus levator anion. Ma'am, A.
Yes, it is caused by levator and coccygeus. Yes, very good.
Non-pregnant with general malaise. Labs high alkaline phosphatase.
Yeah, this question is incomplete. Even I don't understand what it question means.
Vitamin D deficiency, gallbladder disease.
But
Don't know,
they
ma'am.
mark the answer as vitamin D deficiency. But even
Okay.
I don't understand what they mean to say with this. There must be something else in the question. This is very incomplete question.
Okay, ma'am. Increase in caloric requirement after first trimester. 200, 300, 400. I think 300.
It's 200 that we are given.
Okay, 200. Ma'am, isn't it 300 and in second and third trimester and 350 in postpartum?
No, it's 200 in the first trimester, then it becomes 300.
Ma'am, it's written after first trimester.
Increase in caloric after first trimester. Okay, I'll check it. I'll check it today, the guideline book. Okay.
Okay, ma'am.
in the nice guideline.
Answer is 200, but right now?
Yeah, right now it's 200, yeah.
Okay. Scenario of women presented with amenorrhea, galactorrhea, labs were advised, which shows high TSH, high FSH, high prolactin. So, tumor of like the pituitary.
Or it will be, what diagnosis can you make from this?
Hyper.
All the from the hypothalamus they are raised now. So what you will make it?
So it's a tumor of hypothyroid, hypothalamus or pituitary.
Yeah, there must be tumor of hypothalamus or pituitary, adenoma or whatever is given.
Yes, ma'am. Muscle not inserted on perineal body.
Yes, tell us which muscle is not inserted.
Ma'am, they're like which are they talking about? Internal anal sphincter.
Internal sphincter is not inserted on the perineal body. No, only one muscle is there which not gets inserted on the perineal body. It's a repeat question.
Ma'am, inserted in perineal body are superficial transverse perineal, deep transverse perineal, levator ani, bulbospongiosus, then external anal sphincter.
Yes. So which muscle is not inserted?
Ischiocavernosus.
Yes, very good. Ischiocavernosus is not inserted on the perineal body.
Okay.
Yes, okay, let me I'm just removing the answer. Inhibition.
Ma'am, you have got your date for part 3?
No.
It's postponed? Cancelled?
Yeah, no, it's postponed. Even I don't know when will I get it.
You have paid the fees?
Yeah, already paid the fees. Yeah.
Okay.
Yeah. But they do refund it. They refund it if there's something like that, no, they will refund it.
Okay. 24 years woman had LMP 12 days back, presented 96 hours after unprotected sexual intercourse. Which contraception advice will you offer? Okay. Levonorgestrel copper IUCD, levonorgestrel copper IUCD, ulipristal acetate, ulipristal acetate, copper IUCD, scenario of 5 weeks. Okay, sorry. Okay,
No, that
3
is
options. Mm, levonorgestrel is for 72 hours only. So it will be ulipristal acetate and copper IUCD. C.
yes, very good. It is going to be ulipristal acetate and copper IUCD. Yes.
Then scenario of 5 weeks pregnancy, no fetal pulse, pregnancy of uncertain viability. Okay. Scenario of normal rise of beta HCG after 96 hours to 75 in singleton pregnancy. Mechanism of action of POP implants. Inhibition of ovulation. Then drug that cannot be given in third trimester to cause hemolytic anemia. Sulfonamide.
In third trimester, we don't give sulfonamide. And which is the other drug we don't give in third trimester?
Answer is given nitrofurantoin.
Yeah, nitrofurantoin, sulfonamide. These are all the drugs which are contraindicated.
Sheehan syndrome is the anterior pituitary because of PPH. Mechanism of action of methotrexate, dihydrofolate reductase inhibitor. Right, ma'am?
Yes, yeah.
Oxybutynin common side effect, dry mouth, ma'am,
Yes,
and
it is.
blurring.
Dry mouth, yes.
But answer A. Female with length of 2 meters, current BMI 40. To reach BMI 30, she must decrease for IVF. Dash need to lose 40 kg. Okay. Answer is she needs to lose 40
Lose
kg.
40 kg. Yes, exactly. What is this question? I mean, they're asking that how much weight she wants to lose or what they're trying to ask. Even I'm also not getting from them.
I think they are asking that her current BMI is 40 and her height is 2 meters. So if she wants to reach to 30 BMI, how much weight she needs to reduce?
Okay, you
That
mean
we'll
like
have to
this they're asking.
calculate. Yeah.
Okay.
So answer was 40 kg. Abdominal mass, CA. I don't know what is this. Free
Yeah,
fatty
still it is not clear what it is.
free fatty acid are transported via chylomicrons.
Yes, free fatty acids they are transported through chylomicrons.
Patient on estrogen only HRT since 5-year risk of breast cancer. Low risk or no risk? Okay. Hepatocytic
Tell us,
hematopoiesis.
it is if the option is given as low risk or no risk. So what you will choose?
Ma'am, low risk.
Yes, low risk. It is going to be low risk. Yes.
Hemato, hemat, hepatocytic hematopoiesis commences at 6 weeks, ma'am.
Yes, it commences at 6 weeks. Yes.
A man in infertility clinic for azoospermia with regular exercise.
That is,
Hmm.
regular exercise.
Klinefelter, ma'am.
Time filter.
Mhm.
Men with infertility. Yes, it can be this can be, or if there is any other option given to you, like they have given you the option of what we call, if they've given you the option of steroids, so
Okay.
then it can also be because of steroids.
Mm-hmm.
Or if
Azoospermia
they've
is
given
due
you
to
like patient is tall, gynecomastia, then it is going to be Klinefelter.
okay.
TVS frequency 7 to 9 hertz.
Yes.
Megahertz.
Megahertz, yes. It's going to be megahertz, yeah.
7 to 9 megahertz. Okay.
79.
Shoulder megahertz. Shoulder dystocia.
Hmm. What is the
What?
maneuver we do for shoulder dystocia? Yes.
Um, Mac Robert.
Yes. And after first of all, what we do? You directly go for Mac Robert?
No, ma'am. Suprapubic pressure
Hmm.
and hyperextended legs. That is Mac Robert.
Yeah, ma'am.
Yes.
First we go for macrovert. First is
Yes.
macrovert.
Yes. First is Mac Robert. But before Mac Robert, what do you do?
Stop pushing
Hmm.
and
Stop pushing and
call for
yes,
help.
very good. For any emergency, remember it is always going to be call for help.
Okay.
If they're asking you which maneuver you will do first, then it is going to be yes. Then it is going to be yeah, macro about maneuver. But if they're
Mm,
asking you what is the first step you want to do, then it will be call for
Call
help,
for help.
stop syntocinon. If the syntocinon is going to the woman and ask her to stop pushing
Yes.
because she's already in labor, so she must be contracting.
okay. Menstrual cycle of 25 days. Ovulation at minus 14. 11.
Yes, 11 days. Yes, very good.
5-week beta HCG 2400, 4800. 4800.
4,800. Yes, yeah, almost it is 4,800 at this, yeah, around 5 weeks.
Inhibin synthesis in Sertoli cells in male and granulosa cell in female.
Yes, very good.
Antiemetic causes extrapyramidal inflammatory movement. Metoclopramide.
Yes, metoclopramide.
Vitamin C promotes hydroxylation in protein synthesis. Okay, collagen mainly. Yeah. Okay.
Yeah.
Number needed to treat is 1 by attributable RR
Yes,
risk.
yeah. Yeah.
Albumin synthesized in liver.
Liver or liver hepatocytes, whatever the option is given.
Okay, liver hepatocyte. DAMC twins.
Hmm. Morula was for?
Monochorionic and diamniotic.
Yes, and now this is diamniotic, and now this is diamniotic and monochorionic.
Uh, so diamniotic and monochorionic twin.
On what date is formed?
Diamniotic and monochorionic.
Yes,
Day 4.
Nupur,
Ma'am,
therefore,
before
dichorionic monoamniotic. First is di, then di and mono. Yes, very good. It is di and yeah.
So again, morula.
Yeah. Yeah, again morula, or if they've given you like day 4, so you'll mark it as day 4.
before
Implanon major side effect. Erratic bleeding.
Yes. With any of the contraception, you will mark it as erratic bleeding. Just let me search.
Nurpur 171 abdominal mass. What is this? Dash CA.
Incomplete question.
Incomplete. Answer is incomplete.
Yeah, answer is incomplete question.
Okay, Nupur, tell us this one. Okay. Mhm. Oh, just give me 1 second. Mhm. Hmm. Yeah, tell us now.
Okay. Women with beta HCG 155 and after 48 hours beta HCG is 270. No lower
Mhm.
abdominal pain, no G-sac seen, no adnexal mass, no fluid in pouch or Douglas. Normal singleton pregnancy, molar pregnancy, ectopic pregnancy, non-viable pregnancy. Ma'am, like it should increase by 60% in 48 hours. So
Hmm.
60% of this, I think, will be, yeah, okay, normal viable pregnancy.
Yes, it is normal viable pregnancy. Yes, very good.
A woman has got stillbirth at 34 weeks. Her thrombophilia screen shows HB10, platelets 135, protein C normal, protein has decreased. Anticardiolipin negative. Normal pregnancy changes, congenital thrombophilia, acquired thrombophilia, convex outline of uterus. No, that is. Ma'am, this is normal.
These are normal pregnancy changes. Yes, very good.
Okay. Convex outline of uterus, lap and die shows no two uterine cavity.
Uterine
Biconnate.
cavities. Yes, biconnate, but here the
No,
answer
not
is mentioned as
bidiaphrous. Yeah, okay. Wait, I'll
they've
see.
mentioned it
Separate.
as
Yes, ma'am.
septate. They've given the answer as septate. I think in the exam there must be a diagram which is given like that. That is why
No,
they've
ma'am.
identified.
Here they have written convex outline of uterus. Therefore, it is septate. Yes.
Convex.
in
Yeah.
bicornate and
Cornea, it is
didelphus, there is,
it is
yeah,
concave. Yes, yeah.
yes,
Yeah, it is concave.
so
Yes,
it is
very well.
separate. Which PPR is this? Which paper is
No,
this?
no,
This
no, yeah, yeah, that, yeah, that, yeah, Sadaf has asked that which paper is this, yeah.
five patient have normal menstrual cycle, but now she have amenorrhea for 8 months. She is taking metoclopramide and valproate for epilepsy. She has no visual symptoms, no hirsutism. Her serum prolactin is 1,000. Your further management: stop metoclopramide and repeat test. Stop metoclopramide and review for neurosurgeon. MRI bin. Stop valproate and review for neurosurgeon. Ma'am, stop metoclopramide and repeat test.
Yes, very good. You will stop the metoclopramide and repeat the test just to confirm
Okay.
that whether the prolactin level is high because of this or it is by itself.
A patient have IUCD in place for 8 months and now she have complaint of vaginal discharge. Your management.
Hmm. Yeah, this is the diagram below that is given.
It's normal, ma'am.
It's normal. Yeah, so what you will do?
Mm. Investigate.
Yeah, investigation. Yeah. So will you remove the like if will you remove the IUCD or will you keep it intact?
Ma'am will investigate first.
Hmm. Yes, you will investigate, and then you found that everything is okay. She is not having any vaginal. The vaginal discharges by itself. It doesn't have any cause.
So ma'am, reassure.
Hmm. Yes, you will reassure and
Keep the IUCD in situ.
yes,
And review
what you do.
after.
Hmm.
Yes, ma'am. What?
Yeah, what you do whenever this condition is there, like the patient is IUCD and she is complaining of vaginal discharge. So you take the swab, you take the vaginal swab, but you
Compulsion.
don't remove the IUCD. And then
Mm.
after the once the swab result is there, then you can treat her. But after treatment again it is not improving, then you will have to remove it.
Ma'am, which paper is this?
2019.
January 2019.
This is previous was
It is
No, we
together
did
in
only.
it is in together. It is like together in my. I have all the questions together, like mixed up all.
okay.
Like 450
Okay.
questions are there in total for 2019, both in together.
Okay.
Ma'am, today we'll finish all the recalls
We'll try. We can finish as much as we can do it. Yeah, try.
because already we have reached 2019. So only one paper is left, no 2020.
Yes, 2020. Yeah. So okay, one okay. Let's see.
Okay. Minor PPH is called 500 ml blood loss, 5 ma'am B 500 to 1000 with no signs of shock.
Yeah, and if there's signs of shock, then it will be what? It will be major
Moderate
PPH.
neighbor
Major
major.
PPH.
A 25-year-old with chronic left lower abdominal pain for 3 months. She has, okay, this we did, ma'am. Answer: endometrioma.
Yes, endometrioma. Yes.
Direct most common cause of maternal death according to 2007. PPH thromboembolism. PPH?
PPH is the most common cause, or thromboembolism. Thromboembolism is the most common cause of direct maternal death first,
Okay, thrombo.
then followed by PPH.
Okay. Patient having severe preeclampsia symptoms and she's a known case of asthma. Which drug will you give to decrease her BP? Hydralazine, labetalol, methyl dopa. Hydrolysine.
Yes, very good. Because labetalol, it is contraindicated with asthma. So first choice will be hydrolysine. If not hydrolysine is option in the, then you will give methyl dopa to her.
This one. Patient postpartum. Uh, Patient postpartum and is breastfeeding have CT. Due to some reason regarding breastfeeding, you will advise. Encourage breastfeeding. Normally encourage breastfeeding, but send babies UC after 24 hours. What is UCE?
UCE encourage breastfeeding and send babies urea creatinine after 24 hours.
Okay, okay. Encourage breastfeeding normally.
Yes, you should encourage the breastfeeding.
Ma'am, not B, no?
Yeah, not B. You will encourage the breastfeeding.
Okay. A woman have multiple fibroids is planned for hysterectomy. She is on ulipristal acetate prior to her surgery. Which additional contraceptive you will advise?
Yes, we will advise what? IUCD, Mirena. Um, you will advise progesterone contraception, barrier, or OCPs. What you will advise to her?
Which additional? Ma'am, why would we advise something additional? She is already having ulipristal acetate.
Yeah, ulipristal acetate. It is like short acting. Na? It is only as an emergency contraception.
Okay.
And ulipristal acetate, it is given to shrink the size of the fibroid also. In this question, it is not given for the purpose of uh, as a contraceptive method. It is given to reduce the size of the fibroid.
And progesterone only pills?
Or any other?
Barrier,
Progesterone
no?
implants. I
Yes,
use
you will give her. Yes, you will give her barrier method just prior to the surgery, so that she doesn't get pregnant for 1 to 2 days only. We can take it.
Mm.
Okay, okay, okay. Combined oral contraception can be used in women had GTD, gestational trophoblastic disease.
Yes.
Mm. 6 months? 1 year, 1 year.
Yeah. What happens? Yes, we give. We give. It depends. What happens? We check again the level of the beta HCG. Once the level of the beta HCG is returned back to normal, then we can give her OCPs.
Okay, ma'am.
But during that period, what we will give her? We will give her during that period. We usually give her that
Barrier,
barrier
barrier method,
contraception. Barrier contraception is given.
not hormonal, but
Yeah. Mhm. Hmm.
Patient came with vaginal bleeding at home. Now, vaginal bleeding is controlled and all signs clued about complete miscarriage. What will be further management? PT after 2 weeks. DNA. PT after 2 weeks.
Yeah, PT after 2 weeks. Yeah, but ideally we do PT after 3 weeks. I think in the question it is not mentioned what is there, but ideally the guideline always says that repeat the pregnancy test after 3 weeks for medical management. If the medical management and expectant management, just said that you should repeat it after 3 weeks.
A 30-year-old woman having HMB that is disturbing her daily life routine. She is not going to heavy menstrual bleeding. She is not going to plan family soon. Your choice of treatment, Mirena.
Yes, with
Woman is
HMB,
20.
always give her Marina. With remember.
Yes, ma'am. Woman is 22 weeks pregnant. Asked about alcohol intake during pregnancy. Should not be taken at all, ma'am. A.
Yes, it should not be taken at all. Yes,
When does the prophylactic dose of LMWS stop? 12 hours.
12 hours. And therapeutic will be
24.
24 hours. Therapeutic is 24 hours. Let me close the other one. Mm, Yes.
Which structure divide the paravesical and pararectal pouches? Uterine artery, external iliac, internal iliac. Paravesical and pararectal pouches. Uterine artery?
Yes, very good. Uterine artery. Hmm.
Which structure does not contain paracrine glands? Ma'am, labia minora.
No.
Mons pubis and labia majora.
Mons pubis, it does not contain any. Major and minor, it has secretions, small secretions coming from it.
Okay, mons pubis. Okay. Difference between jejunum and ileum. A thin walled jejunum
Okay, let me
is
post this in a, yeah, it is mixed together. You won't be able to identify it. Let me take it in this one so that you can understand.
jejunum is thicker, ma'am. Ileum is thinner. Then jejunum is, I think it is
Yeah, take
shorter.
this one so you understand properly.
So I would see it is thick walled. C, shorter and long arches. Ma'am,
Yes.
C.
Yes, very good. It is going to be C. Yes, tell the above question. Above we have left one question.
No, ma'am. Mons pubis also.
32,
Okay,
sacral
yeah.
plexus.
Sacral plexus is situated behind which muscle? Obturator internus or piriformis? Obturator internus?
Any
No,
other?
piriformis.
Yes,
Piriformis.
very good. It is going to be piriformis. That is just structure. And yeah.
Sacrotuberous and sacrospinous ligament prevent from anterior rotation at horizontal line of spine, posterior rotation at horizontal line of sacrum, downward displacement of ischium and ilium. Sacrotuberous and sacrospinous, they prevent downward displacement of ischium and ilium.
Downward. No. Any other?
Don't know, ma'am. Anterior rotation.
It is going to be B. Posterior rotation at the horizontal line of sacrum.
Okay, ma'am.
And
Then B is the answer.
yes, B. Yes, B. And rectus sheath is formed by
Tenovelars fascia.
and what are the muscles in there?
Sorry.
Muscles.
Rectus sheath. Rectus sheath, external oblique, internal oblique, and transverse abdominis.
Yes, three muscles: external, internal, and transverse abdominis. Yes, very good. And now you are going to tell us this one. Again, it will become like this. Oh. You have to tell the difference between inguinal and femoral hernia.
Inguinal, superior, medial to superior and medial to pubic tubercle, and femoral inferior and lateral to pubic tubercle, inguinal inferior and lateral to pubic tubercle. No, ma'am. This A inguinal. No. Superior. Yes. Another C superior inguinal is superior and lateral to pubic tubercle, and femoral is inferior and medial to pubic tubercle.
Inferior and medial or lateral?
Mm, mm, 1 minute, ma'am.
Inferior.
1 minute.
Yeah. Okay.
Ma'am, it is inguinal is medial, superior and medial, and femoral is lateral and inferior.
Yes. Very
A.
good. Yeah. A.
Then left uterine vein drain into left
Yes. It
uterine.
Inguinal
drains
is
into which branch?
superior and medial. Inguinal is superior and medial.
Yes.
Yes,
Inguinal is
A.
superior and medial. Yeah.
And femoral is lateral and femoral is lateral and
Inferior.
inferior.
Ma'am, in anterior division of internal iliac vein.
Yes. It's a branch. Yes. Very good.
Okay. Source of cholesterol in term fetus: fetal kidney, fetal liver, placenta. Fetal liver.
Yes. Very good. Fetal liver produces.
Bending of cytogenic analysis. G bending.
Yes. A. A to G. Yeah. G bending. Yes. Option A. That is G bending. Yes. Yes. Tell us this
Bile
one.
salts produced by liver. Ma'am, the name ursodeoxycholic acid.
And yeah, corsioxydeoxycholic and cholic acid. Cholic and deoxycholic acid.
Yes, ma'am. Diagnostic test for megaloblastic anemia. MCV. Mean
MCV.
corpuscle. Vitamin B12 level and
Yes,
folate
vitamin
level.
B12. Yes, vitamin B12 level. Yes, very good.
At 4 weeks, primordial germ cells are within what yolk sac, ma'am.
Yes, they are within the yolk sac. Yes.
Major contribution to amniotic fluid by fetal urine. Ma'am, 18 weeks?
18 weeks. Yes, 18 weeks. Yes. Now tell us this one.
Anterior pituitary start to develop from 6 to 7 weeks, 8 to 9 weeks, 11 to 12 weeks. Ma'am, 8 to 9 weeks? No, 6 to 7 weeks.
Yes, 6 to 7 weeks. Very good.
Fetus starts to produce urine 10 weeks.
Yes.
Rectus arteriosus is a structure between which structure? Ma'am, it connects this pulmonary artery to to aorta, arch of aorta, descending aorta.
Yes, aorta with the pulmonary artery. And yeah, let me post the next one. Uh, mm, mm, yes.
Lower two-thirds of vagina develop from urogenital sinus.
Yes, very good.
Posterior fontanelle closes by 2 months.
And anterior by?
18 months.
Yes, anterior by 18 months. Yes. Yes, now can you calculate this for us?
Posterior by 2 months?
2 to 3 months, yes.
2 to 3 months.
Yes, calculate this one, Fakra, for us.
Laparoscopy sensitivity 90% specificity and 90% what will be false positive rate. Laparoscopy sensitivity 90%. False positive is to calculate specificity in this. Specificity. False positive rate.
Yes. Now can you hear me? Yeah. Yes, what did you calculate it?
90. What will be the false positive FPR?
Yes, tell us what it is going to be.
From 2 negative divided by 2 negative plus positive. Then 2 negative divided by 2 negative plus false positive.
Yes, so what it will be?
90 divided by 90 and plus 10, 200. So 900 divided by 100. So 9 by 1. It is 1 minute. 9. Ma'am, 10%. 10%.
Yes, yes, let's ask Nupu what is her answer. Yes, Nupu, what's your answer coming as? Is Nupu here with us? Let's wait for Nupur if she answers for us.
Today is our last class.
No, inshallah we'll have it in between whenever we can have it. You know.
Okay.
We're just trying to finish so that Nupur and Shraddha they can start their revision quickly.
Okay.
Just because only 15 to 20 days are left for them.
Okay. So we can do the calls more.
Yeah. Is Nupur here? Yes, yeah. Okay. Let's check if Nupur is here. Okay, Nupur is meeting. You will take the next question till then. If Nupur comes, then we'll give her again.
Yes, ma'am.
Okay. Yeah, so your answer is right. That is 10%. Yes. Okay, okay, no problem. No problem. Nupur, take your time. Yeah. Yes, sir. Can you see the question? Next question, Pakra?
Yes, ma'am.
73. Histogram shows which variable?
73,
Hmm?
64, 7, 70, yes.
Okay, let me post it for you
Yes,
again.
ma'am.
You find
Yes,
it?
ma'am.
Okay.
No, no, no.
Okay.
Yes, ma'am. Histogram shows which variable?
Hmm?
Time variable, continuous variable, ordinal. Ma'am, continuous.
Yes, very good. Histogram shows continuous. And let me pause the
Continuous.
next one.
Ma'am, I'm not able to get this 10%. Can you please ask
Why?
Fakra to explain?
No, you explain us. Nupur, it's a very simple one.
How did she calculate false positive rate?
Yeah, you tell us. How do we calculate it?
Don't know.
Yes, Nupur, will you? Yes, Fakra, will you explain?
Yes, ma'am.
Okay, yeah, explain.
Formula is, ma'am, 2 negative divided by 2 negative plus 4 false positive into 100 into
Yes.
100. So it is a 90 divided by 90 plus 10 multiplied by 100.
What is sensitivity? Yes, Nupur, tell us what is sensitivity. Can we say call it sensitivity as true positive or true negative?
Ma'am, sensitivity is true positive upon true positive plus false negative.
Yeah. In the, you are telling us in the form of formula. No, it's self-sensitivity. What you will define as sensitivity as?
Sensitivity is, ma'am, the number of the number of true positive among the total number of tests carried out.
Yes, so it is going to be a true positive. And what is specificity?
Number of true negative amongst all the tests carried out.
So now how you will calculate the false positive? Tell us. Now it's very simple for you to do it.
Ma'am, 100 minus 90.
Yes, because it is percentage. Yes, so automatically you will minus it. It's understood that if no one number is given, that it is 100 is given or 1000, whatever it is given, you will minus with from that only.
Okay, ma'am.
Yeah, it was. I thought you'll do it. It was a very simple question. No problem. So you will be able to continue, Nupur, or should I give it to Fakra?
Ma'am, please ask Fakra to continue.
Okay. Yes, Fakra, you will take. Okay, I'm posting it here.
Ma'am, 79. A couple visited fertility clinic. Women have normal investigation and examination. The picture showing Klinefelter's picture asks about what will be the result in man. Testosterone, FSH, LH, sex hormone binding globulin. Decrease in concentration, increase, decrease, increase.
You have to tell all the levels. What happens in Klinefelter syndrome to testosterone, FS, LH, and sex hormone binding globulin? Tell us what happens.
These are three hormones, FSH, LH, and but
FSH,
in
LH,
answer,
testosterone, and that
okay,
also.
four.
Yeah.
Okay,
So,
testosterone decrease, FSH will be increase, and LH, FSH and LH increase, and sex hormone binding globulin.
What is this condition? It is Klinefelter. It is which classification of WHO? You can tell us easily.
Klinefelter, ma'am.
Hypo, hyper, or hyper.
Okay, ma'am. It's a hypogonadotrophic hypogonadism.
Yes, it is hypo. So in hypo, what happens?
FSH will be raised, FSH and LH raised, and testosterone will decrease. And
Yes. So what? So what happens?
so ma'am, A is the answer. Decrease
Yes,
testosterone.
testosterone will decrease. FSH, LH, and sex hormone binding, they will all increase. Yes, very good. And Klinefelter itself is hypogonadotrophic hypogonadism.
Yes. And ma'am, 80, thyroid profile in pregnancy is checked by triiodothyronine, TSH, and thyroid binding globulin. And which okay, thyroid profile in pregnancy check with T3, TSH, and not ma'am with
Ma'am, answer of
it is only
Klinefelter with
it
A.
is
Option A.
A. Ma'am, thyroid profile is checked by TSH and free T4.
Yes, so what you will mark
Answer
here?
so in TSH
TSH
and T3.
yes,
Thyroid
T3.
binding
Yeah, free
globulin.
T3 and free T4. We do it. Free T3 and free T4.
Free
We
T4.
first, and then after that we do TSH. First we do free
Free
levels of T3 and T4.
T4. So answer here is T3A.
Yes, yes, A, option A, yes.
Okay. But not given free. And it
Yeah,
which
free. If
hormone?
the option is given as free, so you will mark it as free first one.
Okay. Which hormone decrease osteoclast activity and increase cartilage deposition at the end of the long bones in term fetus? Calcitonin or growth hormone? Um, hmm, growth hormone?
Growth
Or,
hormone?
no, calcitonin. Deposition of osteoclast activity, decrease osteoclast activity and increase cartilage deposition
Hmm?
at the end of long bones.
Hmm?
Calcitonin.
So, yes, very good. It is because of the osteoclastic activity. You are saying it as calcitonin. Because growth hormone, it has osteoblastic activity.
Growth hormone osteoblastic. And 83, progesterone is increased maximum up to at term 6 weeks, 12 weeks, half life of LH. No, ma'am, this next question. Progesterone is increased maximum up to at term 6 weeks or 12 weeks. Ma'am,
Yes.
at term it will be reduced. Then
Yes,
estrogen
at term it
receptors.
will. Yes, so what will so?
12 weeks. Answer is ma'am. No,
You're saying
not 12 weeks. After
no, not
because
12 weeks.
to maintain pregnancy
Hmm?
and the question, otherwise preterm labor will be started if at 12
Hmm?
weeks
Yeah.
progesterone decrease.
So
So ma'am,
it is max.
so
Yes, very good. Yes, it is going to
term,
be term. Don't confuse with 12 weeks. Yes.
okay ma'am. Yes, and half life of LH,
Hmm?
30 minutes, 6 hours, 12 hours. LH half life it's a sudden surge of LH. So,
Hmm?
but it may, ma'am, only for how I will make its concept. Otherwise, Rata,
Which
no,
one?
because for LH it produce only surge
Hmm?
and then fall.
Yeah.
So, uh,
So what is the half life?
so it's only for in minutes or hours.
Yeah, it is in minutes. Yes.
30 minutes.
Yes, very good. It is 30 minutes only. Yes.
Okay. And in pregnancy, normal physiological changes: A, increase plasma volume, decrease hematocrit, increase blood volume. Increase ma'am, is increase plasma volume, increase hematocrit and blood volume. No,
Hmm?
ma'am, increase plasma, decrease hematocrit and blood
Yes.
volume. A.
Yes, very good. Yes.
A. And now how many days it take the resetting follicle stage to ovulation? 300 days. Yes, when it's a previous recall.
Yes, yeah, it's a repeat question. Yes, it takes 300 days.
And which type of cell junction help in transmission of small molecules from cell to cell in placenta?
Yes, we
Gap
did this
junction,
yesterday.
tight junction, cell molecule help to transmission of small molecule. Gap junctions.
Yes, very good.
And desmosomes and these are options. These are options of
Yeah,
94.
these are the options, different options.
Miscarriage occur due to withdrawal of this hormone. Of which hormone?
Yes, tell us.
Progesterone.
Yes, very good. It is because of the progesterone hormone.
And sex differentiation occur due to short-term Y chromosome. Yes. And BRCA is associated with CA breast 75% and CA ovary 35. And premature ovarian failure have karyotype or mutant gene 46XX, 46XX, and 47XY, 45 premature ovarian failure. And
What happens in premature ovarian failure? Tell us.
46, internal mosaic ovaries streak.
Yes, so what will be your answer?
45XO.
Internal mosaic, no? Why 45x0?
Okay, 46, 46XX.
Yes, female. Yes, it is going to be normal female. Yes.
Normal female. Okay. So
Yes.
it's a is the answer.
Yes.
And I was confused because in Turner mosaic, some patients
Yeah, that
have
is Turner. Yeah, that is Turner mosaic, not simple Turner syndrome. That
okay.
is why you were confused.
They
Yes.
have children and then premature ovarian failure
Yes, they
also.
have premature. Yes.
Oligohydramnios, low set years, limb hypoplasia, renal agenesis, Potter syndrome or Patau? Low set years and limb hypoplasia. Patau?
No, what it will be?
No, Potter. Other
Yes,
is
it is
Potter.
going to be Potter.
Oligo.
Yes,
Low set
46XX.
years.
Yes, Nupo.
Okay, 1146 Patau. Not and Potter syndrome. Its answer is. And 114. A woman with flu-like symptoms and backache delivered baby after 1 week. Baby got jaundice, have hepatosplenomegaly, rash over the body, cause listeriosis, GBS. Ma'am, listeriosis.
Yes, very good. It is going to be listeriosis.
And there will be more choices also in
Yes,
exam.
in the exam, yes, there will be more choices.
And 115 bacterial vaginosis diagnosis criteria according to EMCEL criteria. Clue cells, fishy smell, pH more than 4.5. And neonates with cytomegalovirus symptomatic at birth. Neonates. Ma'am, its answer is with
You tell us symptomatic.
with cytomegalovirus.
Cytomegalovirus.
Yes, ma'am. Cytomegalomaly is
Yes, yeah,
caused.
neonates with symptomatic. Okay, you have to tell the percentage. It is 10 to 15% of the babies they are affected with cytomegalovirus.
10 to 15%.
Yes, Nupur, it's A, listeriosis.
And malaria common, 123.
Most common organism of malaria. Tell us.
Falciparum.
Yes, very good. It
Plasmodium.
is falciparum. That is the most common one.
And which vulval disease associated mostly with autoimmune disease? Lichen sclerosis, eczema, lichen planus, Autoimmune. Eczema.
Eczema or autoimmune?
Autoimmune lichen sclerosis. Scleroderma. And answer is, ma'am,
You tell us. What will be the answer? You tell us.
A.
Yes, A. Very good.
And which of the following is non-epithelial carcinoma of vagina? Rhabdomyosarcoma, leiomyosarcoma, lymphoma. Which of the following is non-epithelial carcinoma of the vagina? Rhabdom is muscle, leiomyo smooth muscles, and lymphoma. Ma'am, B.
B, you are saying?
Leioma.
Okay, let me also think of it. What?
Because
which of the following is non? Which of the following
rhabdomyo is
is the
skeletal
muscular?
muscle.
Yes. So it is
Skeletal muscle.
non-epithelial or it is epithelial?
Non-epithelial carcinoma of vagina. So muscular
Yes, you are.
carcinoma.
It is going to be rhabdomyosarcoma because it is from the muscle layer. It is not from the epithelial like leiomyosarcoma or lymphoma.
Rhabdomyosarcoma.
Yes.
And 135 unmarried history of non-penetrative intercourse. Complain of painful ulcers over vulva. History of non-penetrative Beckett's disease, herpes, uh, non-penetrative painful ulcers. Then herpes.
It is going to, no. Why herpes?
No,
You are saying?
herpes painless.
No, herpes is painful. But
135
what happens? Read the question again for us.
unmarried history of non-penetrative intercourse. Complain of painful ulcers over the vulva.
Yes. So
So
they're
it's
saying
a
is non-penetrative. If they say
okay.
penetrative, then you will mark
Then
it as herpes. Yes.
herpes. So it is
Very
Beckett
tricky
disease.
question this is.
Okay, Beckett disease. And what percentage of lymphocyte is present in blood? Lymphocytes.
Tell us in the form of percentage.
Exact
Okay,
percentage is
20
not
to 40%. 20 to 40% are that lymphocytes or WBCs in the blood.
20 to 40%.
Yes, 20 to 40%.
And 145 radiation exposure with ventilation perfusion scan. 3 days, 3 months, 6 months, 12
PQ
months.
scan, yes, tell us.
We PQ scan.
Hmm.
3 days.
3 days with PQ scan?
VQ scan, radiation exposure.
3 days or 3 months?
Effect on fetus or mother or
Yeah, fetus,
any.
on the effect on fetus.
Okay,
But
3
because of
months.
it, 3 months. And for the chest X-ray, it is 3 days, 3 to 7 to 10 days. So it will be for the chest X-ray, that will be 7 to 10 days.
If mother has chest X-ray, then effect on
Then
fetus.
it will be for 7 to 10 days.
Okay. And for 46 ultrasound resolution maximum at focal region, interface, gray, or axial. Maximum at focal region.
Focal region? It is at interface.
Axial. Interface.
B.
B. Interface. I was thinking the probe is rays are more focused, then it has more resolution. It's not true.
Yeah, it is not like that. Yes.
Type of TVS probe used in OBS women, a low frequency curvilinear probe, high frequency curvilinear probe, low frequency linear probe, high frequency linear probe. Ma'am, high frequency.
Yes, it is going to be.
Um,
We are saying which option? High frequency and
high
curvilinear or linear probe?
frequency linear.
Yes, very good. It is going to be
Linear.
option D. Linear, high frequency,
D,
linear
last.
probe. Yes, yes, very good. And then, no, I haven't
Ma'am,
posted any question after that.
ma'am,
Yeah.
answer is delta or
Yes, yeah, delta, yes.
delta.
Yes, delta.
150, 156, 6 week
Hmm.
gestational amenorrhea, gestational sag of 20 mm, fetal pole 4 mm, no fetal heartbeat seen. What does it indicate? 6 week, a fetal pole 4 mm with no fetal heartbeat is appropriate for gestational age, or fetal pole 4 mm, no fetal heartbeat shows no viable pregnancy. Fetal pole 4 mm with no heartbeat show viable pregnancy. Gestational sac of 20 mm is appropriate for gestational age. Uh, Ma'am, 6 week. C, C, ma'am. Fetal
Why
pole 4
C?
mm with no heartbeat viable pregnancy.
No, what is happen with fetal
Show
pole?
viable.
When
C,
this
ma'am.
form, no,
Yes, ma'am.
what it will be?
No,
Not C, no.
no. So it's a fetal pole with no shows no non-viable.
No, how come non-viable?
No, ma'am. No.
Gestational sac is more than 20
Gestation
millimeter. 20
is
millimeter.
appropriate. Yes, ma'am. Appropriate for gestational size. 20 mm.
So
Gestational
what you
size.
will mark as? Option D, yes, it
Fetal
is.
pole. D.
Yes, D. Because,
Gestational size.
yes, for miscarriage, it is supposed to be less than 7 gestational sac, mean sac diameter.
And
Less
with
than
no
7,
fetal
and
pole.
fetal port will also be less than 7 or no fetal heart rate you will find. So it will be miscarriage.
At 6 weeks.
Yes.
In a study, uh, com- in a study comparison of singleton and twin pregnancy is made,
Hmm.
if cervical length less than 20 mm, then double chance of preterm before 34 weeks. In twin has singleton. If cervical length less than 20 mm, then the double chance. And if cervical length less than 30 mm, then double chance of preterm before 34 weeks in single.
Hmm.
Ma'am, if cervical length is less than 2, then double chance of preterm before
So what you
34
will
weeks.
mark here?
A, ma'am.
Yes, very good. You will mark it as A. Yes. If cervical length is less than 20, double chance of preterm labor before 34 weeks of pregnancy.
Yes, ma'am. And this is 157.
Hmm.
And next question.
Yes, next
Next is
question. Yes, go down. You'll see
uh,
the next question.
okay,
159.
160, 159. No, ma'am,
Yes,
165.
hemolytic disease. Hemolytic disease in newborn is detected by.
Hemolytic in newborn, 159 hemolytic disease in newborn is detected by hemolytic anemia.
Hmm. Direct womb
Hemolytic,
test, indirect womb test status, which it is detected by.
ma'am, on it can be done on mother.
Hmm.
Indirect,
Direct.
indirect womb test.
Direct.
Direct on
Direct.
fetus,
Yes. Yes.
fetus,
Direct will.
direct womb test. And that is for clear test,
Yes.
that is
Yeah. That
indirect
is that.
womb.
Yeah. That is. Miss. Now
And
can you see 160?
160
Hmm.
FBS fetal blood
Yes.
sampling 7.23
Yeah.
your action.
Yes. What will be your
Uh,
action? You will repeat
Stud-
the fetal blood sample. You will do cesarean section. What you will do?
Ma'am, normal range was 7 point, less than up to 7.25. So it is low.
So what you will do?
Fetal blood sampling.
So
And
you will repeat it, or you will
repeat,
repeat
repeat
after
after 30
30 minutes.
minutes.
Yes, yes, very good.
And repeat after 30. And now 165 women have history of 165.
Yes, 165. Yes, tell us.
Women have history of salpingectomy due to ectopic pregnancy. Recurrent risk in next pregnancy of ectopic is 1:3, 5:10, 15:20. Um, when there is a high risk normally. So exactly, 5 to 10.
Yes, 5 to 10. Very good. Yes.
And patient having GDM, what is her lifetime risk for diabetes type 2? 5 to 10, 15 to 20, 25 to 30, 45 to 55. GDM has exactly um, confusion between B and C.
Yeah, no problem. Try it out. Tell us.
B, 15 to 20.
Yes, it is 15 to 20%. Yes.
15 to 20%. And 167, risk of miscarriage with amniocentesis. 1%, 2%, 5%. 1%.
Yes. And what is the risk of CVS also? Tell us.
CVS, CVS has more risk. I think
Yes,
that is
more
in
than
early pregnancy.
1%. You
More
say
than
you call
because
it as one more than 1%.
it is the amniocentesis up to 15 to 20 weeks, but the CVS in early before 14.
Yes,
So it
exactly.
it has more risk.
Yeah, it
And
has more risk.
CTG paper frequency 1 centimeter, 2 centimeter, 3 centimeter.
Tell us what is the frequency
And
of the CDG paper?
uh, ma'am, 2 centimeter. No, yeah,
2 centimeter?
when
No. Yes, it
one
is 1
centimeter,
centimeter.
1
Yes.
centimeter. But it will depend on we can adjust accordingly, or it's a standard.
Yeah, it's a standard.
Okay. A small square of ECG 0.02 second or 0.04 second. Small square of ECG 0.02.
0 point B, 04.
B to 4, 0.04.
Yes.
And 31. No, 26. Mechanism of action of doxorubicin.
Hexazocin. Yeah, tell us. Dexa.
Uh, well, I don't know.
No
It,
problem. Try it out.
doxorubicin,
It is
what is
alpha
this?
blocker. I'm giving you the option. Alpha blocker, beta blocker, alpha 1 and beta blocker. What you will choose?
Doxorubicin. It's alpha.
Yes, very good. It's an example of an alpha blocker, dexazocin.
Alpha block. And anti-HIV drug, uh, maybe what is this?
Yeah,
Rare,
anti-HIV, yeah. Retilgavir. What is the
retroviral,
mechanism of action? Yes, you tell us what is the mechanism of action.
retroviral. My, my
Okay,
formula is
I'll tell you,
very
no problem. No, I will tell you, no problem. It is integrase inhibitor.
integrase inhibitor.
Inhibitor, yes.
Integrate.
Yes,
Okay.
integrase.
And 31, a postmenopausal woman, patient with urinary frequency and dysuria, topical estrogen given. how they have improved symptoms by action on a bladder mucosa, bladder trigon, or lower vagina, upper vagina, external genitalia. Urinary, bladder mucosa, bladder trigon, ma'am, lower vagina.
Yes, lower vagina. Even I also think it is lower vagina.
Yes, ma'am. Estrogen
Yes,
increase.
because of the estrogen. Yes.
And IgG transport to fetus, active or pinocytosis. Ma'am, active.
Yes, very good. It is going to be active. Yes.
And 33, cytomegalovirus infection in second trimester, risk of congenital infection 20 to 30, 30 to 40, or 10 to 20. Second trimester, risk of congenital infection. Cytomegalo. 20 to 30.
Yes, 20 to 30. There are three percentages for it.
Um,
I don't.
yes.
I'm forgotten for the third trimester. I'll share it by looking today at the guideline so that we
Okay.
don't. Yeah, I'll share it over there. In the group.
At 16 weeks, secondary herpes infection, counsel for 16 weeks secondary herpes.
Hmm. Will counsel for
Um,
what?
mm,
Is baby at risk of a miscarriage? Anomaly is what?
okay.
Tell us.
There is a risk of um, mm, risk of miscarriage at 16 weeks,
16 weeks there is risk of miscarriage.
and anomalies also.
Hmm. So what you will choose?
Anomalies, miscarriage,
Anomalies?
anomalies,
Why
and
anomalies?
neonatal. No, ma'am. No, ma'am. Okay, choices are given. I was thinking
Yes.
choices.
No. No. Choices are given.
Miscarriage, anomalies, or neonatal infection. Ma'am, neonatal infection when
Yes,
baby
because it is
delivered.
secondary herpes. It is not primary herpes.
Yes, ma'am. Yes, this is
Yes.
neonatal infection. Okay. 38. Uh,
Hmm.
Factor 8 produced by hepatocytes, Kupffer cells, endothelial cells. Um, Factor 8. Um, and Factor 8 is produced by hepatocytes
Any
or
other
Kupffer.
option?
Kupffer cells.
It is produced by
Endothelial.
yes, endothelial cells. Yes, very good.
Endothelial cells. Endothelial. Okay. And growth factors. These are
Hmm. Yes.
produced by
Yeah. Hmm.
fibroblasts or fibroblasts or platelets. Uh,
Yes. Tell us.
Vascular endothelial growth factors are produced by
Yes, ma'am.
uh, um, I don't these are produced by fibroblasts.
It is produced
No.
by
Ma'am, fibroblasts,
platelets.
platelets, vascular endothelial growth factors. Okay. No, I will remember because in
Yeah. Yeah.
preeclampsia,
Yes. That is what. Yes. You will always
in
remember it now.
preeclampsia, because in preeclampsia these are disturbed and damaged
Yes. These are the
vessels.
factors that are disturbed.
And so, and malaria prophylaxis, Nifaquine in second and third trimester, Primaquine in second and third trimester, or Atvoquine is safe in pregnancy.
Hmm.
Ma'am, normally Mifequine, we give, I think.
Hmm.
Mifequine,
Yes. Very good. It is mefloquine. So what will be your option?
A.
Yes. Option A. Yes.
Um, where is there is, and next question is, ma'am.
Tell us.
Right. We are 44. Indwelling catheter removed. Antibiotic prophylaxis needed in all patients, diabetes, elderly, obese. And indwelling catheter removed. Antibiotic prophylaxis needed in all diabetic, elderly, or obese. Ma'am, diabetics,
Yes, it can be diabetic or it cannot be any other option when in elderly
and
also. What do you say?
elderly, yes,
And
and
I'm also
obese.
was having this confusion between the two options.
Elderly, obese have also risk of
Yeah, risk of
infection,
infections. Yes.
but which have more
Yeah, that is the diabetes one that are more at risk.
diabetes. Yes,
Yes. Yeah,
diabetes have.
diabetes. Yes. Yes, diabetes they have the more risk.
If elderly and obese are normal because diabetes is disease.
Yeah,
Condition.
diabetes. Yeah, that is why diabetes is a disease.
If trauma occurred during insertion of catheter, is a fourth option. No, so answer will be B. And Bartholin abscess, marsupialization 2 weeks back. Now swab result. Few pseudomonas seen, and GBS seen. Wait for cultures and sensitivity. Treat pseudomonas to GBS. Um, pseudomonas and GBS seen. When how seen? These are seen after culture.
Yes,
Then
they are
wait
saying
for.
they are seen after culture. Yes.
So, mm, so we have to wait for culture and sensitivity,
You have to
no?
wait.
Or treat it.
Yes, you tell us what you will do.
Or treat, treat pseudomonas.
Yes, we will treat pseudomonas. Yes.
We treat pseudomonas. And 46. 4 days after urgent C-section, patient came from home with shortness of breath and leg swelling, ECG, chest X-ray, ABG all normal. What to do next? CTPA, VQ scan, and compression duplex leg ultrasound. Um, ma'am,
Yes, tell us what you
compression
will.
duplex. Ma'am, C, compression duplex leg
Compression
ultrasound.
duplex. Why?
For DVT, no?
Yes, very good.
Shortness,
Yes, and it is the confirmatory test for DVT.
uh,
Yes.
uh, and C is the answer. And 47. COCP started in normotensive patient. What advice to give? Check BP while starting this, and BP every 6 months, every years, every 4 years. Mechanism of
Hmm.
mechanism of IMP. What is Im,
Sorry, this
implant?
is yeah.
This is
That is
the
other
next
question.
question.
Yes.
This is the other question. So these are options. Check BP when starting. BP every 6. No, ma'am. A.
Yes. You when you
If
will
it,
start, you will check the BP. Yes.
mechanism of implant.
Implant. Yes.
Implant. This is subdermal implants, sir.
Hmm.
They
So
inhibit ovulation because they are mostly levonorgestrel
yes, they again they inhibit. Yes, very good.
ovulation.
Yeah. Now tell us this one. Uh, mm, yes, this one.
1 minute.
Mm.
Fakra
Yes.
46
Yes. Yes.
BQ
Yeah. Compression. Yes. No. No. Compression. For DVT,
compression.
we always we always do compression duplex ultrasound.
Okay.
Ma'am, this placenta separates at delivery from
Hmm.
endometrium. Uh, A. Nutabash and Bacillus.
Hmm.
Placenta separates at delivery from endometrium. And ma'am, it's a previous repeat question, I think.
Yes, it's a previous repeat question. Yes.
I think at that time um, answer was a
Metaboc, yes, very good.
ma'am, what is database mean? But
Basically, it is a remnant which is left
oh
after
yes,
the.
yes, yes, yes. It told me previously, but I
Yeah, yeah, no
yes,
problem, no problem. You'll remember it.
inshallah. Endometrial cavity obliterated by fusion of decidua capsularis and parietalus, capsularis and bizalis. Ma'am, capsularis and bizalis.
Yes, very good.
Hemorrhage, luteal cyst, most vascularized portion. A theca, B cumulus oporus, and mural granulosa, and D basal lamina.
Hmm.
Hemorrhage, luteal cyst, most vascularized portion. Theca, cumulus oporus, mural granulosa, basal lamina. Luteal cyst. Luteal cyst of the ovary.
Yes, yes,
So
what?
it's theca, bizalis, you, not confirmed, but
It is going to be C, mural
Unity
granulosa.
mural granulosa. Okay,
Hmm.
before C and 56. In cholestasis with pregnancy, at what level bile acid can affect the fetus? At 10 micromole or B 20 and 30 or 40.
Hmm.
Effect on fetus, ma'am. 20,
20 or 40.
40,
Yes, very good. It is going to be 40. The guideline says it is 40.
40. CTPA at 31 week, radiation exposure to breast tissue, 100, 150, uh, C30 and 20. CTPA 31 week. Um, 150 mega
150
radiation.
or any other?
30,
Hmm.
20. I don't know exactly. 100. What is the exact answer?
Yes, it is 20.
20. In PPH, platelets should be transfused if platelet count reaches 70, 80, 100. Ma'am, 80.
Yes, very good. It is 80 when we transfuse it. Yes.
And
And now,
spinal
hmm,
hypertension caused by a block of dorsal root ganglion, block of preganglionic autonomic, ischemia of vasomotor center, venoconstriction.
hmm,
No, venoconstriction. Um, hypertension is called a block of autonomic. Preganglion. B.
B,
Mm,
not A.
ischemia. Ischemia of vasomotor, no, venoconstriction. Or maybe A. Dorsal root.
Yes, very good. It is going to be A.
Dorsal root ganglia. And treatment of GBS in labor. Benzyl penicillin. Yes, ma'am, answer is given. And treatment of syphilis, penicillin G IV, benzyl penicillin. Uh, penicillin, treatment of syphilis, penicillin G.
Yes, it is penicillin G. Yes, very good. Benign penicillin is for GBS, and syphilis for syphilis, it is GBS.
G. And 64. Painless vulval lesion and lymph node enlargement. Treponema pallidum. So, and
Mm-hmm.
CTG tachycardia with chorioamnitis case of PROM, and patient's cervix is 5 centimeter. Tachycardia with chorioamnitis case of PROM, and patient is do urgent cesarean or antibiotic or fetal blood sampling.
Mm-hmm.
Chorioamnitis, ma'am, do urgent cesarean.
Yes, because it is chorioamnitis. Yes, you will do
Yeah.
urgent cesarean section.
And Filchi clips of female sterilization made up of aluminum, nickel, or silicon. Ma'am, silicon.
No, they're made up of
Nickel? No,
nickel.
nickel. They are
Yes,
metallic. Okay.
yes. Yeah, it was part 2 question also. This question, it came in my exam of part 2. This question.
Okay. So, ma'am, how we can know? Because we are
No,
a
no,
part
even I
one
did not
student.
knew it. I just gave it a tukka in the exam. Even I did not knew it. But then I found out it is correct. Yeah.
But in the 10 teacher, it is written that is about metallic, but I'm not sure about nickel.
Yeah, yeah. It is given in the guideline. Then we
Okay,
checked it in the then we checked it later on.
okay. Vast deference absent scenario. Vast deference is absent. Some male congenital
Yeah,
anomalies.
that is which congenital anomaly? Tell us.
Vast deference. Ma'am,
Hmm.
name of the disease is not,
Yes,
but
cystic fibrosis.
cystic fibrosis. Okay, cystic fibrosis. Vast deference severe. And and RMI calculation, that
Hmm.
is when post-menopausal status, and ultrasound report, and
Hmm.
mm, one thing more,
Yeah, ultrasound.
CA125
Yes,
value,
you went to yes, very good.
or multiplication,
Yes.
and epiphyseal closure in female at puberty due to um, epiphyseal closure due to growth hormone
Yes, very good.
and estradiol B. Estradiol, testosterone, estrone. These are options of epiphyseal. Okay, estradiol, testosterone, or estrone. So estrogen.
Estrogen?
Uh,
Which estrogen? Diol or estrone?
1 minute, ma'am. My laptop is off. Now
Okay.
I'm opening mobile.
Yeah, yeah,
Ma'am.
yeah, no problem.
60 epiphyseal closure in
Hmm.
female breast. Estradiol, testosterone, or estrone. Um, estrone is the postmenopausal
Yes,
estrogen.
yes, very
So
good.
is
So,
the estradiol.
yes, very good. It is going to be estradiol. Yes.
Shoulder dystocia, BP in biparietal diameter. So by BP incidence. Shoulder
Hmm.
dystocia. What is BP? BP is 2 to 3 or 16%.
Hmm.
Um, Two
Social
to three.
dysplasia in shoulder dystocia not had that happens. What happens? PPI. What we call
By
like that?
trochanteric diameter. By
Yeah,
trochanteric.
yeah, 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 yeah. Biparietal.
Biparietal knot. Shoulder dystocia. Shoulders by trochanteric diameter will be increased. Huh?
Yes. Yeah.
So
No, 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 no,
incidence
no,
is
no, 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 no.
no
Shoulder dystocia, BPI, brachial plexus injury. Yes,
injury. Okay, okay,
yes,
ma'am.
brachial plexus injury.
Fracture injury incidence is 2.2 to 3 or 16%.
Yes. I think I don't. I'm feeling like these questions are from part two because this question is also again from part two.
Okay.
Hmm.
Because these are clinical questions, not
Yeah,
basic.
exactly.
Ma'am, answer
Is 2.3
equal
to
by
16%.
2. Okay, ma'am. This is range. Okay,
Hmm.
2.3 to 16%. Oh, and POP mechanism of action,
Yes.
progesterone only pills.
Tell
They
us what
also
is it?
inhibit ovulation
Yes, very good. They inhibit ovulation.
and electrocautery frequency.
Hmm.
Uh, electrocautery frequency 300 kilohertz to 5 megahertz. 3 megahertz to 5 megahertz, or 30 to 300 hertz.
Hmm.
Uh, and 3 to 5. B, 3 to 5.
So A.
A,
A.
okay. 300 to 5 mega, 300 kilohertz to 5 megahertz. These units are,
Yes, 3 and yes, these units are correct. That is written here.
these are correct. Okay.
Yes.
Fetal warfarin syndrome.
Hmm.
Smooth philtrum, mental retardation,
Hmm.
stippled epiphysis or IUGR. Warfarin. Mental retardation.
No, in fetal warfarin syndrome, mental retardation occurs. No, what happens?
Fetal warfarin syndrome. Smooth
Hmm.
muscle,
Fetal
stippled
embryopathy,
epiphysis.
warfarin embryopathy. What is it?
Smooth philtrum. And embryopathy, some CNS problem or mental. So I was thinking that mental retardation.
Hmm. It is going to be B, stippled
B,
aphysis. Yes, B.
stippled epiphysis. Okay. And functional unit of kidney develops from metanephros. And postnatal 4 days what happens to kidney volume in fetus? No change, twofold increase, twofold decrease, fivefold increase, or fivefold decrease. Postnatal 4 days, fetal kidney volume, kidney volume in fetus. Uh, ma'am, ma'am, no change
No.
or change?
Yes,
Change
there is
in
change. Yes. What is the change?
uh, twofold increase, twofold decrease, fivefold increase, fivefold decrease. Twofold increase.
Yes, very good. It is twofold increase.
Okay. SCG peak in pregnancy at 8 to 12 weeks. This answer. Okay.
Hmm.
Feature of imminent preeclampsia that you will assess: hyperreflexia, clonus, headache, epigastric tenderness, facial edema. Imminent eclampsia, ma'am. A
Hmm.
headache
Headache you will assess?
and I, but imminent eclampsia, hyperreflexia, and clonus.
Yes. Because you will be able to assess that. You will able be to check it with the hammer. You can check it
Okay.
whether it is. Yes.
126, 6 centimeter functional cyst in young patient, what to do? Follow up with ultrasound in 6 months, MRI, ultrasound, and CA1 to 5. 6 centimeter. Follow up with ultrasound in 6 months.
Yes, very good. You will do it. Follow up with. Yes.
And ovarian mass found on exam in gynae outpatient. Next investigation. Ovarian mass, ultrasound pelvis, MRI pelvis, CT pelvis, ultrasound pelvis.
Yes, very good. You will do ultrasound pelvis. Yes.
Hydrocephalus obstruction site, foramen of Lashka, cerebral aqueduct. hydrocephalus, uh, ma'am, aqueduct, cerebral
Yes, very
aqueduct.
good. Yes, very good. It is going to be cerebral aqueduct.
And 138 cell salvage in C-section after how percentage blood loss? More than 30%. More than 30% we will start cell salvage.
Yes, after more than 30%, we start with the cell salvage.
Okay. And 153 incidence of transition of leiomyoma to leiomyosarcoma, 0.1.
Hmm.
This is 0.1%.
Yes, this is point.
After treatment with methotrexate, give flonic acid. These are repeat questions.
Yes, that is a yes. So what you will mark?
Flonic acid, ma'am.
Yes,
Because these
folinic.
are all answer is given, and but these are repeat also.
Yes, this is also repeat. Now let me take the
153.
paper. Yeah, let me take the other questions from this. They don't have any like options or. And let me see if there's other 2020. Mm-hmm. Adapted share 2020. That is September 1. Can you open? I'm sending this file in the group. Just open it.
Group
Yeah,
fire.
the group. Yeah, I'm sending in the group. Mm, yes. Did you got it in the group?
Yes, ma'am. I
Oh, yeah, yeah.
taking
Open
time
it.
for
Yeah,
downloading.
yeah, yeah. No problem. No problem. Take your time.
Question 1, 28 September. Aminoglycoside group of antibiotics after which um, NV eighth cranial nerve
Hmm.
effect on eighth cranial nerve, and
Hmm.
so aminoglycoside acute inflammation persists for how many days? 16 to 18 days. And common site of endometriosis is ovary. And the SIADH, antidiuretic hormone syndrome,
Hmm.
it's inappropriate syndrome, associated with which tumors? Small cell CA of lung. And cell lysis done by which component of complement system? Membrane attack complex.
Hmm.
That is C6, C7 answer. And the skin glands are homologous to the prostate in male. And
Yes.
percentage of uterine perforation after IUCD insertion is 1 in 5,000. LNG
Hmm.
release from Mirena per day is 54 milligram, but ma'am, correct answer is 20 microgram per day.
Yes, 20 microgram.
And a platelet transfusion indicated
Hmm.
when uh, platelet level below 70 into 10 raised per 6 per
Or
unit.
below 80. New guidelines is below 80.
Tetanus toxoid vaccine type is deactivated exotoxin. And
Hmm.
BRCA gene type is tumor suppressor.
Hmm.
And BRCA gene associated with which cancer? It is uh, apart from breast and ovary.
Yes, tell us.
That is pancreatic cancer or
Very good. Yes.
prostate cancer. And uh, bodily
Hmm.
reaction such
Secretions,
as
secrete.
s- secretions,
Bodily, yes,
bodily
secretion.
secretions such as cervical secretions attacked by lysosome.
Hmm.
SCM
Standard error of
calculation.
mean.
standard of mean calculation ST divided by under root n
Yes.
divided under root n
Hmm.
is equal to 3, ma'am. What is this
Yeah,
3?
that is 3 in the question. There must be some calculation that you have to do it. So answer must be 3 from that.
Okay.
Yeah.
Allen twice develop from where?
Hmm.
And no, this is
Endoderm.
endoderm.
Yes.
Okay. No,
Hmm.
because all genital tract develop from
Yeah,
swamp
all of them. Yeah.
endoderm. Yeah.
Hmm.
DNA polymerase function.
Hmm.
DNA polymerase. What is the function of DNA polymerase?
Yes, tell us what is the function of DNA polymerase?
Because maybe my
Hmm.
mind is
It is
exhausted.
no, 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 no. Okay, okay, no problem. Tell me when you're tired. I will read it. No problem.
No. I can read, but answer. I
Yeah.
can't
Okay.
answer
Okay. No
because
problem. No.
it's a
What is the DNA function polymerase? The function is to DNA repair. It will
DNA
repair the.
repair.
Yeah.
Okay.
It will repair the DNA,
DNA repair. Okay.
and after repair, it
And
will add the
ultrasound
nucleotides.
add nucleotides.
Hmm.
Yes, you teach us, but we are not good students.
No, 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 no. You
ultrasound
will
pick
remember it. No problem.
ultrasound pick complete mole karyotype. 46XXY or 46XX. And for is complete mole for 69 XX. I think.
Complete mole is 69 or partial mole is 69?
Partial mole. Yes, that was
Yes.
partial. It's a 46
Hmm.
XX.
Yes.
And cystic fibrosis inheritance 1%, and cystic fibrosis congenital absence of vas deferens, and okay, this will repeat. And lithium toxicity which affect craniofacial bone or
Yes.
skull, and any patient has
No,
Crohn's
tell us
disease.
lithium toxicity causes what? You tell us. Lithium causes what? This
Ma'am,
is the
it
wrong
is
answer.
heart, ma'am,
Yes, which? Hmm.
heart effect on heart, lithium
Yes, in the
toxicity.
heart, what it causes?
Mm,
Epstein
um,
anomaly.
which anomaly, ma'am?
Epstein anomaly.
Epstein,
Yeah, EB. Yes.
EBSTEN.
Epstein anomaly. Yes.
Epstein anomaly, lithium. And
Yes.
patient anemic, 21 question number,
Hmm.
has Crohn's disease, had bowel resection, and
Hmm.
previously, and complain of numbness and paresthesia.
Hmm.
Hemoglobin 9.8 grams per deciliter, MCV 120, hematocrit normal, WBC is normal, which deficiency? Because paresthesia, numbness, so it's a B12. Now
Yes.
effect on nerve.
And MCV is
And
also
cardiac
raised.
MCV is markedly raised. Yes.
Hmm.
And cardiac output in second stage of labor is 40%. But ma'am, previously today it was discussed that 50%.
Yeah,
Cardiac output
50%.
second stage.
Yes. So here
Yes.
maybe the option is not present, but whatever your closest option will be. But normally it
Okay.
is 50%. It is written in
50%.
Hertz.
Okay. Missed pill on day 12.
Hmm.
Patient on COCP had have unprotected sex on day 12, took day 13 pill as
Hmm.
regular, and attend the doctor for further management. Take missed pill and continue the pack. And because at day 12, if six pill, seven pills continuous take,
Hmm.
then no need for further
Yes.
contraception. I think.
Yes. So what will be the
Identification.
hmm?
So continue
Yes, take the
because one
mistle and
period is
continue their pics. Yes.
uh, identification of muscles of perineum. That picture will be given. And
Yeah.
branch of internal iliac artery, picture internal pudendal artery. And
Hmm.
arterial supply of Bartholin glands, superficial external pudendal artery.
Hmm.
And pic of pudendal, picture of pudendal nerve. And
Hmm.
then in interval internal anal sphincter made of which muscles?
Hmm.
Circular muscle layer of the rectum.
Hmm.
And placenta, pic of placenta, that was placenta previa. And
Hmm.
mechanism of action of apixaban,
Yes.
direct inhibitor of factor 10A.
Hmm.
And metabolic changes in pregnancy, respiratory alkalosis, RMI calculus A1 to 5 menopause status and ultrasound.
Hmm.
And MRI patient, uh, intramural fibroid. And
Hmm.
CTG question, fully dilated cervix, head at +2 position, occipito anterior position. And management, uh, change mother position.
Hmm.
So or left lateral or walk, I think.
Yes.
But
Yes. Will
+2, no,
turn.
she can't walk, or we will turn her and change her some position,
Yeah, left
so I
lateral
think
position so that, yeah.
and so that she will be delivered.
Hmm.
And ECG hypokalemia,
Hmm.
and ECG atrial fibrillation ECG. And PCO2 high, normal, pH 7.2. And PCO2 base excess,
Hmm.
metabolic acidosis.
Hmm.
And site for urea cycle happen in
Hmm.
liver. And 39, enzyme for glycolysis present in the cytosol. Robertson translocation occur in 13, 14, 15, 21, and 22
Hmm.
chromosome. And a picture of chromosomal mutation of translocation.
Hmm.
And 42, uh, patient complaints of abdominal pain. 7 weeks amenorrhea, urine pregnancy positive, and negative ultrasound scan. Ultrasound
Hmm.
scan shows irregular intrauterine sac with the right adnexal mass, which can't be separated from the ovary. And a
Hmm.
corpus luteal cyst is seen. Next appropriate investigation is beta HCG, 2 samples in 48 hours. If rising,
Hmm.
then it's a live pregnancy.
Hmm.
And then 43,
Yes.
first trimester. First trimester, 9 weeks pregnancy with mild vaginal bleeding. NTD given. What is the indication of NTD? Her? Ma'am, if no, not in medical or medical or spontaneously resolved, but if
Hmm.
instrumentation, then
Yes,
we
yes,
give
then, yes. Whenever there's any instrumentation, or like previous baby also had like she's RH negative mother. She's an RH negative
uh,
mother, then also we'll give her.
NTD. But not
Hmm.
in women. If medical management or spontaneous resolve, pregnancy is spontaneously resolved, or
Hmm.
then in first trimester, no need for NTD in negative mother.
Yes, then
But
it is not no.
uh,
Like there's a confusion with this. Nice guideline. It says that you give it, but that the RCOG says it don't give it.
yes, ma'am, RCG, 10 teachers in
Yeah, it
are
says,
saying
yeah.
don't give. During development of liver and biliary system,
Hmm.
hepatic bud invaginate with into which structure? septum transversum. And semoma bodies contain calcium. This repeat question. And which hormone maintains corpus luteum in pregnancy? HCG, beta HCG. And remifentanil preferred as the labor analgesic, ultra short acting.
Because it
It's
is
ultra
ultra
short,
short acting.
ultra
Yes.
short acting drug. And suxamethonium crosses placenta easily. And due to high lipid because suxamethonium is highly lipid soluble. Analysis of time of induction and delivery data was non-parametric and unpaired. And what test to be used? Man witness
Repeat question. Yes. Tell us.
test,
Yes.
because it's the
Yeah.
two
Non-parametric and unpaired test.
non-parametric and unpaired.
Yes.
Okay. Which change in breast cancer occur in lactation? Lobular hyperplasia. This okay, my answer is lobular
This
hyperplasia.
is, yeah, this is the repeat question.
Yes. Radiotherapy by placing in vagina is a brachytherapy. And lichen planus lichen planus associated with which type of cancer? Squamous cell carcinoma.
Yes.
And odds ratio calculation, A divided by B and divided by C oblique D.
Yes.
The
A, D,
odds
B,
ratio.
C. Yes.
Yeah, A,
Here it is written as wrong. A, B, C, D. No, it's wrong. A, D, B,
no,
C.
ma'am. A into D divided by C
To B.
into B. B.
Yes.
Yes, ma'am.
Yeah.
It
Here it
is
is written as wrong. Yes.
cross A into D divided by C into B.
Yes.
And BMI calculation,
Hmm.
height 150 centimeter, weight 90 kg. Uh, which obesity class? Class 3. BMI is height divided by
Divided
weight.
by weight.
Height
Yes.
in centimeter divided by weight in kg.
Yes.
And p-value of 0.05. What is probability of type 1 alpha error?
Hmm.
1 in 20.
Yes.
And dye used for what is
Contrast in MRI.
contrast in MRI is zodilium.
Yeah, it is
Zodium.
zodilium. Yes, it is zodilium. It is gadolinium. It is not iodine.
Gadolinium.
It is,
No,
yeah,
yeah,
it is wrong. It is,
gadolinium.
yeah. Hmm.
Gadolinium. And uh, what does
Tell me when you
black
are
area?
tired. Huh? I will read it. Tell me when you are tired. So I'll read it.
Okay. Okay. What does black areas in ultrasound indicate? It's anechoic. And the
Hmm.
distance between the and peak and trough of ultrasound.
Hmm.
Yeah, peak and trough. This
Yes.
I'm studying trough wave is
Yes.
amplitude. Okay,
Yes.
ma'am.
It is amplitude.
That is crust and trough.
Yes. Question trough.
Natural background risk of chest X-ray at 10 days. 9
Hmm.
point. Remember, it's equal to 9.7 days.
Yeah. 9.7 or 10 days.
10 days. Formula for calculating sensitivity. True positive divided by true positive plus false negative into
Hmm.
multiplied by 100.
Yes.
And NVP calculation,
Hmm.
negative predictive value.
Hmm.
Its
Yes. Tell us
formula,
what is the formula. Yes. Tell us.
negative predictive value, that is a false positive,
Hmm.
that's and divided by false positive plus
Hmm.
uh, false true anyway, false positive
Hmm.
divided by false positive plus true negative
Yes, very good.
into 100. And mother has active genital herpes infection at the time of vaginal delivery. Then risk of neonatal uh, 80% active genital herpes, then vaginal delivery. But correct answer is 40 to 60.
Yes.
And a picture of cervix with the markers beyond transformation. Which
Zone.
epithelium beyond transformation zone,
Yes.
and which epithelium is a columnar. Inside the cervix is columnar and outside the squamocolumnar junction.
Yes.
Where does Arista-Stella reaction occur? It occurs in endometrium.
Yes.
And a frontal urethral caruncle is a it's due to trauma, infection. Carbon that was a urethral carbuncle.
Yes,
That was
there is
due
now
to
what? Yes,
estrogen deficiency.
hypoestrogen. Yes, hypoestrogenism. Yes.
Hypoestrogen deficiency or hypoestrogenism. And picture during laparoscopy showing arrow on which structure. There was some picture that was obliterated umbilical artery. And a picture of genital mutilation types. Type 1 clitoridectomy, and that is partially clitoris is removed. And type of necrosis in brain, that is solid parts of coagulative necrosis.
Yes, very good.
And right upper quadrant uh, um, right upper quadrant E in hyperemesis maximum score.
PUC score. Tell us what is the maximum PUC score?
Right upper quadrant E means, ma'am, RUQEE is for
No, it is
uh,
PUC score. It is a PUC
oh
score.
puke.
PUC score.
Puke score
Type.
in hyperemesis. Okay, maximum score is ma'am, that was 15.
Yes, 15. It is
15.
given in the guideline.
3 to,
That is
3 to
15.
15 is range. Range is 15.
Yeah.
3 to 15. And maximum and which process involves in amplification of DNA in viral infections? That is PCR.
Yes.
And which artery is injured in sacrospinous fixation? Inferior gluteal artery. And which structure exists through the exit through the less sciatic foramen? That is a tendon of obturator internus.
Yes.
And SBA formation in fetus starts at which time of the development? 16 weeks, 20 weeks, 36 weeks at birth. Adult hemoglobin formation at birth.
Birth?
When
No,
fetus
before birth. What happens?
adult hemoglobin,
Mm-hmm.
um, it has a very few adult hemoglobin, I think.
Yes. Yes.
Fetal hemoglobin is more.
Mm-hmm.
And so it will be found at 20 weeks after
It is
just
found between 32 to 60 weeks.
30. So answer is 36. Okay.
Or or we can say, okay, here 28 weeks is given in the option. Na? In the option, it is
Hmm.
given as 28 weeks. Yes. So, no, okay.
No, ma'am. Only
No, on
36,
28.
20,
Okay.
and 16.
Yeah. So
So
what you will
36
mark,
is
you will, okay. If you get the option will be, the correct answer is for adult hemoglobin, it is synthesized at 28 weeks.
28. Okay.
Yes. Here it is, the option is not given.
But if not given, then we can mark 36.
Then you will mark it as 34 because it is a near one. Whatever is
Ma'am,
near to. In the exam, it will be given
look.
because it is a recall question
Okay.
again. Yeah.
Okay.
Yeah. It will be marked. It will be.
Testosterone converts
Dihydrotestosterone.
dihydrotestosterone by 5 alpha reductase.
Hmm.
And enzyme present in granulosa cells but not in theca. That is aromatase in
Hmm.
which causes aromatization of and produce estrogen. Of
Yes.
and Ebola virus is double-stranded RNA.
No,
And
single stranded. We studied yesterday. It's an example of a single stranded.
ma'am, today we have studied, and Nurpur told that it is a double-stranded
No,
RNA.
no, single stranded. Single stranded.
Single-stranded. Okay,
Yes, Ebola is always single stranded.
okay, single-stranded RNA. It's a wrong answer, double-stranded.
Yes. Uh-huh.
And Warfarin embryopathy occurs at which gestational age? 7 to 9 weeks. This repeat question today.
Hmm.
And Treponema palladium. Uh,
Yes, Treponema palladium.
um, PR, RPR negative diagnosis,
Hmm.
biological false positive. These are options of this
Yes,
question.
these are the options. Yes.
Uh, Biological false positive. Answer is
Yes, you tell us what will be the answer. It is going to be okay. It is going to be for biological false positive. This is the also a repeat question in 2017 where
bi-
it is complete question
biological,
is given.
biological false positive. If Treponema palladium is present, then is a biological false positive.
Yes, because this is the only exception. Penicillin with penicillin, there's a risk.
Okay. That's
Yeah.
79. Painful genital ulcers with inguinal lymphadenopathy. Diagnosis as chancroid. Causative organism is H. dushri and
Hmm.
herpes dushri. And most common malignant tumor of the newborn, meningomyelocele, neuroblastoma, sacrococcygeal teratoma.
Yes.
And histopathological disruption, cartilage, epithelial, carcinoma. Cartilage plus epithelial. So, and picture of mature cystic teratoma and left-sided abdominal pain, dysmenorrhea, I don't know, and
Hmm.
LMP 3 weeks ago,
Hmm.
left-sided abdominal pain, LMP 3 weeks ago, and no other abnormal finding. Laparoscopy done
Hmm.
and lab fixing diagnosis.
Hmm.
Ovarian endometrioma. Then it's a dysmenorrhea that is missing. So it is
Yeah.
ovarian endometrioma.
Endometrioma. Yes.
And infertility workup 5 years. Female, no abnormality. Male physical features shows no baldness, breast develop,
Hmm.
osteoporosis, and small testes,
Hmm.
and female type disc of pubic
Pubic
hair,
hairs.
distribution of pubic hair,
Hmm.
decrease
Hmm.
FSH and LH, uh, and sex hormone binding globulin increased and testosterone increased.
Hmm.
Um, so, ma'am, it's a Klinefelter.
No, it's
That's
similar
clear.
to
No?
Klinefelter because she is a female. He is not a
Okay,
male.
okay. Okay, infertility workup 5 year. Okay, female
Female,
with
no abnormality.
no. Okay.
Hmm.
FSH decrease and LH decrease. Hypogonadotrophic hypogonadism.
Yes.
And because testosterone and sex. So diagnosis is breast develop and no baldness, osteoporosis, small testes,
Hmm.
and a female type distribution of hair. Androgen insensitivity?
Thing as androgen
No,
insensitivity. Androgen insensitivity. It can be
because
androgen insensitivity.
no,
Yes.
because she has small testes and
Yeah,
female
that is why you are
and
considering, na? Yes. Yeah, it
mm,
can be because of this also. Yes.
so exact answer is
Yeah, exact answer is not like options are also not given that what will be the.
Okay. So
Hmm.
X XY hermaphrodite or exactly I don't know.
Yes, yeah. Hmm.
And which hormone, ma'am,
Hmm. Yes. Which
if you have
hormone?
answered, which hormone produced by
Yes.
fetal adrenals,
Hmm.
soap, and placenta, uh,
Hmm.
and, and placenta causes fetal lung maturation.
Hmm.
Cortisol, 11-deoxycorticosterone, testosterone, androstenedione, which hormone produced by fetal androgens and placenta causes fetal lung maturation. Ma'am, cortisol.
Yes, very good.
Hmm. And drug given to 200 women and placebo given to 200 women. So it's a
Hmm.
randomized. And in the group, drug group 5, female develop severe adverse
Hmm.
effects. And
Hmm.
in placebo group, 10 female develop severe adverse effects.
Yes.
How many number of women needed to be treated with the drug to develop severe side effects? What
Yes, tell us.
the number to be treated one divided by A, then the formula was
Yeah.
AP,
1 divided by absolute risk.
absolute risk.
Hmm.
So 1 divided by uh,
Drug X given to 200.
250 250 women and 200 in one group and 200
Yes.
and
Hmm.
so it's 1 divided by at risk to the 400 ma'am. No
Yes, it
ma'am,
will be.
and 200 1 divided by 200 because who are taking drug they are at
Yes,
risk.
people who are taking the drugs. Yes.
So 1 divided by 200 is equal to 0.005. So divided by 100.
Hmm.
No, multiply by 100. So then answer will be 50. 1
Hmm.
divided by 200 multiplied by
Number
100.
X is given. Maximum given to
So
100. Hmm.
point 0.5
0.5. Then you will multiply by 100. Hmm.
50.
Hmm.
Then answer will be 50.
Yes. So nearby option will be in that question will be here it is given as 40.
40. Yes. So during calculation, if we have nearby option,
Yes,
then we
yeah, we will choose. Yes, we will choose a nearby.
mechanism of action of labetalol
Hmm.
is a non-select. No, it's a selective beta 1 and beta
Yes, sir. Yes,
2
selective.
receptors. And minute ventilation increases in pregnancy 50%, that is. And
Hmm.
respiratory acid. And what does arrow indicate in this by pH, bicarbonate pH 7.8,
Hmm.
normal in human.
Yes.
Where
This
is this
graph.
type?
Yeah, I don't understand what they're talking about this graph. I think they're talking about this graph.
Ma'am, maybe in physiology of respiration.
Yes, maybe they
Uh,
are
shift,
talking in that term.
oxygen dissociation curve, that
Hmm.
shift.
Yes, it may be that oxygen dissociation curve.
Okay. Respiratory acidosis answer is. And MC direct causes
Most common cause of direct maternal mortality.
mortality is according to 2009 is the thromboembolism.
Yes, it
But
is thromboembolic. Hmm.
it UK in first word. I think not in third word.
No,
Third
not
word
in
is
developed
PTH.
countries. Yeah, yeah, that is PPH over there.
And site of factor 8 production,
Yeah.
hepatocyte, Kupffer cells, endothelial cells. That's
Yes,
what it
very
is.
good.
Sequence from right to left.
Mhm.
SVC APT. What is this?
The superior
Sequence
vena
from.
cava, aorta, and then pulmonary artery in the sequence. You will have to
Okay.
answer it from right to left. In
This is gross anatomy.
yeah.
Okay. Superior vena cava,
Mm-hmm.
aorta, and pulmonary trunk.
Mm-hmm.
Um, from right to left.
Yes, you will treat it
Left.
from right to
Mm,
left.
okay. And nerve root of pudendal nerve, CS34, S234.
Yes.
And cranial, cranial nerve injured during forceps delivery, that is
Mm-hmm.
facial nerve.
Mm-hmm.
And 38 peak primi with severe itching in the palm and sole of scoliosis. No
Mm-hmm.
other feature, risk bile acid raise to management, so admit for induction. Also
Mm-hmm.
deoxycholic acid and repeat bile acid levels at 40 weeks.
Yes.
And botulinum toxin used in
Mm-hmm.
diffusor muscle overactivity.
Yes.
The mechanism of action is block
Mm-hmm.
the release of acetylcholine from the preganglionic and postganglionic nerves in the efferent nerves.
Mm-hmm.
Oxybutynin, question number 97.
Mm-hmm.
Oxybutynin antimuscarinic causes dry mouth and
Mm-hmm.
dry skin, and other is
Mm-hmm.
diarrhea, bradycardia, and dry eyes. Then
Tell us
it
what
is
it causes.
dry eyes.
Yes,
Or
oxybutynin
dry
causes
skin,
all everything dry, dry, dry.
not diarrhea and bradycardia.
Yeah, not diarrhea and bradycardia.
Box and Whisker plot, which does the upper and lower border represent upper and lower quartile range.
Mm-hmm.
This is also repeat question.
Yes.
And data collected of BMI in women with the history of shoulder dystocia and delivery, and then compared with the BMI of women with vaginal delivery. What type of
Mhm.
study? Because retrospective cohort studies, because patients are
Yes.
delivered. And biochemical role of aerobic acid um, in collagen synthesis, hydroxylation.
Mm-hmm.
And 101, second line treatment of nausea and vomiting in pregnancy, chlorpromazine, domperidone, metoclopramide, ondansetron, and arpachlor,
Mm-hmm.
prechlorproxamine. Then second line are domperidone, metoclopramide, and ondansetron.
Mm-hmm. Yes.
And treatment for listeriosis,
Yes, tell us.
ampicillin,
Mm-hmm.
cephalexin, erythromycin.
Mm-hmm.
Uh,
Here the option is not given, the correct option. Tell us what is the treatment,
listeriosis. Yes.
the drug of choice.
Today I think Nurpur told us.
Yes, yeah.
Mm, but I'm not remembering at this
No
time.
problem, no problem. It causes amoxicillin. Amoxicillin is the drug of choice.
Amoxicillin. Okay. Listeriosis.
Yes.
Amoxicillin. And characteristic features of chlamydia: obligate intracellular, gram negative cocci,
Yes.
and blood supply of anterior two-third of transverse colon is a middle scolec artery.
Mm-hmm.
And Female presented with postmenopausal bleeding,
Hmm.
and diagnosed with the granulosa cells trauma, tumor of granulosa cell tumor of ovary.
Hmm.
What will be the change in the endometrium?
Yes, we
Atrophic
did this question. Yes.
female diagnosed with the granulosa cell tumor of the ovary.
Hmm.
What will be the change in the endometrium? Atrophic endometrium, luteal endometrium, secretory endometrium, or proliferative? Granulosa cells में
Hmm.
uh,
Gender cells secrete what?
as secrete estrogen. So,
Hmm. So
proliferative changes.
yes, very good.
And site of production of active form of vitamin D, kidney,
Hmm.
liver, brain. Site of kidney.
Yes.
And HPL plateau after where was the
Hmm.
question?
HPL, that is human placental lactogen, plateaus after what gestation age?
HPL placental lactogen at term or at 36-week gestation.
Hmm.
Human placental lactogen, ma'am.
Hmm.
Lactogen that produce more at term or
Yes. Yes.
36
At term, that is the third trimester. Yes.
third term, yes, after 36 weeks. Yes.
Yes.
Clinical scenario, T4 increase, TSI decrease,
Hmm.
diagnosis, Graves' disease, Hashimoto's, TSI low, and so Graves' disease.
Yes. Grave disease. Yes.
And
Hyperthyroidism.
but ma'am, in
Hmm.
hypothyroidism, TSH is okay, and
Hyperthyroidism T3 and T4 will decrease.
TSH is.
Yes.
Mechanism of transport of oxygen and carbon dioxide through the placenta is simple diffusion, simple facilitated diffusion, or carrier mediated. Simple.
Yes. Simple diffusion.
And to which carbon atom nucleotides are attached in DNA? C1, C2, C3, C4, C5, C2, C3, C1, C2.
Yes. C1. It's again a repeat question.
Yes. Gartner duct is a remnant of mesonephric duct.
Hmm.
And lower part of the vagina in embryological development, developed by
Hmm.
urogenital sinus.
Yes.
And heparin comes under which group? Protein, glycoprotein, polysaccharide.
Tell
Ma'am,
us.
yesterday we was
You did it. Yes. Tell us.
polysaccharide.
Yes. Very good.
Endometrium in myometrium, adenomyosis.
Hmm.
And tumor of fallopian tube. Description is given: a papillary serous adenocarcinoma.
Yes. It is again a repeat question. Also, this one is also repeat one.
Root of ilioinguinal nerve and iliohypogastric L1. This
Hmm.
also repeat. MC nerve,
Most common now.
most common nerve injury in gynecological laparoscopy.
Hmm.
Femoral pudendal obturator. Um, obturator.
Yes. Very good. It is obturator.
And pick of partograph. Arrow indicates action line because it's a 4
So 4 centimeter. From 4 centimeter, we take it as action line.
on the, against the opposite to the
Hmm.
action line. Okay.
Yes.
Patient has get diabetes mellitus, risk of secondary type 2 diabetes in future life 45 to 55. Previously we studied some things
No,
like low.
that was not gestation diabetes. That was other type of diabetes, I think.
No, no, the same question that
Yeah.
GDM. Yes, yes. but
Okay,
the
so
risk
did
was
you?
20,
What
20 to
the
30.
option was given? I will check in the guideline.
There was options were given in that question. That was
Yeah, I'll
20.
check in the guideline. Yeah, I'll the knife it is mentioned. Yes, I'll check it and will tell you.
Ultrasound pick of fetal head.
Hmm.
But no options are given. Mechanism
Yeah.
of action of POP, inhibition of ovulation and cervical mucus thickening. And
Hmm. So
that,
what will you mark?
ma'am, inhibition of ovulation. Inhibition of
Hmm.
ovulation.
No, for POP.
For POP, yes, ma'am. Inhibition of
Yeah,
ovulation.
inhibition of population cervical. First is cervical mucus thickening and then POP in POP.
And then inhibition. First
Yes,
is cervical mucus. Oh,
yes. First cervical mucus thickening. That is in the nice guideline.
okay, okay. Because POP not causing 100% inhibition of ovulation.
Yes, yes.
Because 50 plus
Yeah.
something. Okay, ma'am.
Hmm.
And arthritis, ma'am, what is this? Rhesus?
Rheumatoid arthritis.
Arthritis,
Rheumatoid arthritis.
rheumatoid arthritis, impression in pregnancy due to which immune cells decrease TS cells,
Helper T1 cells.
helper
Rheumatoid
T1.
arthritis it improves in pregnancy due to which immune cells? It is helper T1 cells. And SLE it gets worse in pregnancy due to which immune cells?
Increase in
Increase in helper
uh,
T2 cells.
helper T2 cells. Okay, that is autoimmune. And
Yes,
but
both are autoimmune conditions.
both are hydrocephalus caused by. But
Hmm.
arthritis, I think the arthritis decrease also improve due to hormones of pregnancy, which are steroids in nature.
No, no, this is given line. This line is given the Oxford division note.
Okay,
The arthritis improves and the SLE it decreases.
okay. Hydrocephalus caused by blockage of which structure?
Hmm.
Aqueduct of Sylvius. This is a repeat question. And
Yes.
thyroid-releasing hormone, when produced by its precursors, how many copies are produced from one molecule? That are 6 copies.
Hmm.
And electrolytes disturbance in the hyperaldosteronism, uh, hy- hypernatremia, hypokalemia,
Hmm.
hyperaldosteronism.
Hypertension because aldosterone level is increased, so sodium will be increased and potassium will decrease.
So it is hypokalemia,
Yes, hypokalemia and hypernatremia.
hypernatremia.
Mhm.
So answer is ma'am, hypokalemia.
Yes, hypokalemia, hypernatremia, and hypertension. This whole line is the answer.
Okay, hypernatremia, hypokalemia, and hypertension. Okay.
Yes.
MCC, most common cause of Cushing disease, pituitary adenoma, and mm, uh, admission, Addison's
Edison.
crisis,
Mhm.
Addison's crisis, hormonal change, um, Addisonian crisis.
Mhm.
OJ, remember which hormonal change?
Yes, tell us which what happens in Edison disease. You remember?
Uh, it's a alkalosis condition mainly. Uh, so ma'am,
What will happen? There's lack of energy, weakness. Yes,
yes,
increase thirst
uh,
because the adrenal gland level is increased.
increase. So
No, no, it is sorry, Edison, no, it is decreased. Adrenal glands they
decrease,
produce the hormones, it is decreased.
decrease. So uh, so steroids and all hormones are decreased, and so hypokalemia,
Hypo hormonal changes will take place.
uh,
Like cortisol will decrease,
cortisol
um, uh,
decrease, and
then all the like glucocorticoid and all
reticulars
these they
and
will be affected. Yes, hypoadrenalism, adrenal hormones will also decrease. They all will
so
decrease.
okay, hormonal changes.
Yes.
But options will be given.
Yes. Yes.
So
Yes.
one
There's
option will be okay.
yeah.
Maybe set of hormones are given 4 to
Hmm.
5 and
Yes. You will have
yeah,
to choose.
okay. OGTT fasting blood 5.8 2 hour after breakfast 7.9
Hmm.
and and interpretation of this gestational diabetes mellitus 5.7.9 is
Hmm.
ma'am 5.8 and
Yes. So
7.
what
These
is
are
it
in
going to
normal,
be?
ma'am. This is normal range.
Yes. This is
No,
normal range. So it will be.
yeah, normal.
Yes. It is going to be normal. It is again a repeat question.
Pedigree chart, third degree generation, third generation, 5, 4 of 5 affected, children
Children.
affected,
Yeah. Yes.
affected. First and second generation not affected, and
No
no
carrier.
no carrier, and consanguous marriage in second generation.
Hmm.
Uh,
So answer is de novo mutation.
yes. Ma'am, 1 minute. My speaker is.
Yeah. Yeah. No
I can't
problem. Problem.
listen.
Okay. Okay. Yeah. Yeah.
Um,
You want me to read it for you? Let's see
yes,
if
ma'am.
Nupur.
Please,
Okay. Sadaf, can you? Nupur, can you? And Sadaf, anyone can do it?
1 minute, ma'am.
Okay. Okay. Let's ask if they can do it.
Ma'am,
Otherwise,
yes,
I'll.
yes, ma'am. What should I do?
Can you read it for us the scenarios?
Which one, ma'am? This pedigree chart?
Yes. Yeah.
The pedigree chart,
Hmm.
third generation, 4 of 5 children affected.
Hmm.
First and second generation, not affected, no carrier. Consanguineous marriage in second generation. So it is de novo mutation.
Yes.
Yeah, because first and second generation it's not there, and after 1 2 skip generation it's coming there for de novo mutation.
Yeah. Yeah. That is why it is de novo.
Okay, 130.
Hmm.
5 GCAT to 3 dash and 5 dash ATC. Okay, what is the complementary stand? Okay,
Yeah.
I mean,
You
it
have.
shouldn't be. Okay,
Hmm.
okay, 3 dash to 5 dash.
Yeah. 3 dash to 5 dash. Yes. It is the question is written wrong way.
Okay, and then ATGC. Yeah,
Yeah. ATGC. Yes. It will go in the opposite direction.
yes, ma'am.
Yeah.
Okay, which immunoglobulin is a pentamer? Immunoglobulin M.
Hmm.
Then IgG.
Hmm.
To 80% of total IgG cross placenta. Okay, IgG is 80% of total immunoglobulin. It crosses placenta, binds to Fc fragment, and it is responsible for secondary immune
Yes.
response.
Yeah. Okay. Okay. It's like this. Yeah. Hmm.
Question number is
133.
133. Okay.
Mechanism of action of nevirapine. It is non-nucleoside reverse transcriptase inhibitor, NNRTI. Brunner cell are present in duodenum.
Hmm.
Hmm.
Okay. Brunner cells, they're present in the duodenum. 135, there's a picture of HP electrophoresis. So the answer will be beta thalassemia major, like we did it in the morning. It will be the same question. I think it's a repeat question.
Yes, ma'am.
And 136, what is the sympathetic supply of urinary bladder? So sympathetic supply is from the inferior hypogastric plexus.
Sorry, ma'am. I
No,
had a
no, no
call.
problem. No, no, no problem. No problem.
Okay, 135. Peak
Hmm.
of HB choruses, it showed beta thalassemia major that we did.
Hmm. Hmm.
Then sympathetic supply of urinary bladder, inferior hypogastric plexus. Ma'am,
Hmm.
we did, and we chose pudendal now, isn't it? It was rectal. Okay. Oh yeah.
No, yeah.
Okay.
Pudendal will
Rectal
be
is
the parasympathetic. Sympathetic will not be pudendal. Pudendal is a parasympathetic supply mostly
okay.
in most of the cases. Yeah,
So
majority.
sympathetic supply of urinary bladder is to inferior hypogastric plexus. Okay. Which organism can be cultured by high vaginal swab? Gonorrhea. Okay.
Hmm. Gonorrhea and
GI.
chlamydia both can be done. Both the options are there, so you will mark both of them.
Okay, ma'am. GnRH neuron development from neural crest cells. Okay.
Hmm.
Circumflex artery is a branch of external iliac artery.
Hmm.
Then ROC curve, x-axis, y-axis, sensitivity and 1 minus specificity.
Yes.
Nerve passing below inguinal ligament medial to anterior superior iliac spine. Ma'am,
Hmm.
we did this lateral cutaneous nerve hai.
When I'm passing below the medial to what assistant?
Anterior superior iliac spine.
Yes, that is lateral cutaneous nerve of thigh. Yes, it is not femoral nerve.
Yeah, okay. Cells involved in acute pelvic inflammatory reaction.
Hmm.
Histiocytes, dendritic cell, macrophages. Okay.
Hmm. They have just given the names that it is like this.
Mm. Patient from Asian origin complain of fever, cough, X-ray pick diagnosis, tuberculosis.
Hmm.
Okay. Safe method in electrosurgery. Safe method in electrosurgery.
Hmm.
Ma'am, what is the answer?
There's no answer, but I think it should be like the same one. Attach the pad. There was like we don't attach the pad. That one will be. I think it's a similar type of question like that.
Okay. Which cellular changes are more prone to develop endometrial carcinoma? Atypical hyperplasia.
Yes.
Okay. Then female complaint.
Hmm.
Female complaint superficial dyspareunia, itching in private parts and with grayish colored and vaginal discharge. Examination erythematous swallow vaginitis. Likely causative organism. Trichomonas
Hmm.
vaginalis.
Although it is gray color should be bacterial vaginosis, but because of the itching, it is trichomonas.
Yes, ma'am. Why? Which type of estrogen is produced by placenta? Estriol.
Hmm.
Uh, what technique is used in PCR? Amplified DNA.
Hmm.
Most common clinically significant congenital heart disease. Ma'am, it was VST. I read somewhere. We did it.
Yes, yes, yeah, we did this last time also. Most common.
VST, no? Ma'am,
Yes,
it's VSD, no?
yes, yeah, it's VST.
Okay. Where is external urethral sphincter located? In deep perineal space. Yes.
Hmm.
Three technique used to detect receptor proteins in endometrial sample. Immunohistochemistry.
Yes.
Difference. Difference in mechanism of action of aspirin and ibuprofen. Aspirin is ma'am irreversible blocker and
Hmm.
ibuprofen
It
is
is reversible. Yes.
okay. Site of action of vasopressin in kidney.
Hmm.
Vasopressin is ADH, antidiuretic hormone that acts on DCT and collecting duct. Is it?
Yes. Yeah. Vasopressin.
Okay.
Yes. Anti-DIH. Yes.
Okay. Gap junctions. PCOS plus infertility management, metformin and clomiphene both.
But before that, you will do?
Weight
Yes,
reduction, lifestyle.
yes, yeah, lifestyle modification, that is weight loss, and then metformin and clomiphene separate.
When we start both together,
No, we start one by one, or we can start both together also, depending on the patient. Like
okay.
metformin, we are giving basically to control her sugar level, and clomiphene for induction, ovulation induction. So if infertility, she is here for the problem of infertility, so we'll give her clomiphene also.
Okay, ma'am. Then choroid plexus invaginates in which structure? Dura mater, ependyma. Pia mater, dura mater and ependyma. Okay.
So it's not ependyma, right plexus. Choroid plexus.
Ma'am, what's the answer?
They're in the ventricles of the brain. Yes, it is going to be. It forms invagination in the pia mater. Forms invagination in some part of the ventricles. This is pia mater one. Which is the option with pia mater?
Pia mater and arachnoid mater.
Yes, yeah, B option.
Okay, ma'am. Animal source.
Hmm?
Pia and arachnoid matter.
Yes.
Animal source of vitamin A. Retinyl palmitate, isoretinin, retinol. Retinol, ma'am.
Yes, retinol. Do check in the exam. Sometimes it is you will be given the option of retinal and retinol. So you will mark as retinol, not retinal.
Okay.
Here it is written as retinal.
Okay.
Yeah.
But ma'am, retinyl palmitate, is this right? The above one?
No. It is retinol. O will be there in retinol.
Okay.
Yeah.
HPV16 gene grows on which layer of tissue? Basal cell. HIV positive 16-week pregnant female with high viral load, so high CD4 count more than 200. What is the time to start ART? 18 weeks, 20 to 24 weeks. I'm 20 to 24 weeks.
Yes, 20 to 24 weeks.
Ma'am, high viral load, then we start immediately, no? Isn't it?
No,
But
higher
she has
order.
count.
Okay, there are other options also given 30 weeks and 32 weeks. What is the time to start? We usually start in the third trimester near the end time so that the baby can get the maximum effect. If all the options are given, it will be 32 weeks.
Okay, ma'am. Role of protein C in coagulation cascade. Degradation of factor 5A and 8A. Okay. Blocking a part of large blood vessel by producing a spark in electrosurgery. Fulguration.
Yes.
Okay. Urethra is increased up to what length during stretch? 4 centimeter. Ma'am, usual length is 4 centimeter. 4, 6, 8, 10. So it is increased up to 8.
You can increase up to. I will have to. I'll check this because I'm also not sure that because 4 and 8 to 6 they are very near options. I will check this.
Okay, ma'am.
Increase up to what length?
158 answer is
158. 32.
20 to 22.
32.
32.
Yes.
Okay. Most common fungal infection during catheters and prosthesis, Candida.
Yes.
Post-void urine volume in a female age 65, 50 ml, 75, 100, 150, 50 ml.
Post-void residual volume. Yes.
Muscle not inserted to periistiocavernosus. Failure rate of COCP with perfect use and imperfect use. Ma'am, 0.1 and 9?
Yes, 0.1 and 9.
Yeah.
It is a complete
Which,
chart. We did that, yeah. This we'll also look it over there also, the what is the perfect, so that we can remember the normal. But this here it is going to be 0.1 and 9, yeah.
which hormone affects increase in sweating during pregnancy?
Yes,
Thyroid.
yes, thyroid, yes.
Calcitonin synthesis, parafollicular cells or C cells. Which layer of adrenal gland synthesize and reticular? Site ADH synthesis, neurosecretory cells of hypothalamus, paraventricular and supraoptic.
Yes.
Like of constitute how much percentage of total cell population of anterior pituitary? Percent, 30%, 50%. Ma'am, how
We
much?
did this yesterday. Nectotrophs. Yes, tell us. Yes, Nupur, you did it yesterday, yeah.
But the answer was not complete. The question was not complete, so we couldn't. I think we didn't answer.
Okay, so it will be almost 10 to 15% or 10% if the option is given to you.
Okay, ma'am. 10%.
In
And
case of range, it will be 10 to 15%.
okay, ma'am. Effect of 2,3 DPG on the chart. Increase in 2,3 DPG will shift the chart to left.
Left
No.
side. Yes,
Yes,
it will
left.
be left side. Yes. And what will be the conditions that shift it on the left side?
Excess.
Yeah,
Yeah.
everything will be in excess. Increased temperature. And what else was there?
Exercise, increased temperature, and acidemia, acidosis.
Acidosis. Exercise was
Increase
also there.
PCO2
Yes.
also increase.
Yeah. 4 things were there. And I'm also now forgetting.
2,3 DPG.
The next question.
Yes.
Yes. T wave in ECG represents ventricular depolarization. Vital line duct connects midgut and yolk sac. And smooth and rough endoplasmic differ in what? Ribosomes are present in rough endoplasmic reticulum. And cell orbital where fatty acid synthesis occurs, cytosol and smooth endoplasmic reticulum.
Reticulum. Yes, we are this cytoplasm. These are not the
174 proximal teratogenic effect.
Yes, tell us. You tell us. Paroxetine. We did
Paroxetine,
yesterday or day before yesterday. We did this question. Yes, tell us.
heart, lung, and kidney. I'm not sure.
Yeah, no problem. Tell us what you remember.
Paroxetine, heart.
Yes, hard. Very good. It is hard. Serious or hard. If you're okay, can we do that paper also? The remaining 2018?
Too tired.
Okay, no problem. We'll do it tomorrow then.
Okay.
Okay, ma'am. Ma'am, only that much is left now.
Yeah, that's what, yeah.
So maybe only half an hour or 1 hour more.
Yeah. It will take only, yeah. That much time only, yeah.
One class is more.
Yeah. And then we can have a in between class. Not every day we can collect the questions like what are the confusions. So we can decide the day and we will do it, discuss it.
Okay. Okay, ma'am.
Ma'am, all the questions that we did, can you please share the answer key so I can revise again
Yes, yes,
the
yes, yes.
that we did today
Hmm.
and that.
Yeah, yeah. I'll send it just now. Yeah, I'll send
Yes,
it. Yeah,
Thank
you
you,
will
ma'am.
share answer.
no
Ma'am,
problem. Hmm?
you will
Yes.
share answer key of this paper also. This is
No, no,
which year?
yeah, it is.
These are
No, no,
random
it is.
question.
Yeah,
These
these
are
are the
random question.
random. Yes, these are the random ones. Yes.
Okay.
Yeah, whatever I have, I'll share all of them now because almost we have covered all the
Hmm.
papers now. No? I'll share all them now.
Okay,
Okay.
thank you.
No problem.
Tomorrow I have to travel, so I will listen. I will try to listen.
Tomorrow?
Yes, ma'am.
Okay, okay, no problem, no problem. Or
Okay.
we can
Ma'am.
do it any other day if it's okay because only few questions are just left, so we don't have any much problem for that.
Okay.
Yeah, yeah, we can
Okay, ma'am.
decide it. No problem. Okay.
Okay. Thank you, ma'am.
Bye.
Okay.
Thank
Thank
you.
you so
Love
much.
this.
Tomorrow
Okay.
is there is class or not? Sorry to interrupt.
Yeah, yeah, definitely we'll have.
Okay, okay,
Okay,
ma'am.
ma'am.
Yeah.
Bye.
Sure. Love this.
Enough
Thank
is.
you.
Thank you.